Okay, we are live.
Hi, all. This is DOC Gazer.
Yes, we can hear you.
Okay, great.
Thank you. Hi, I see that CHS is on.
Hi, yes, good morning. Can you hear us?
Yes, we can
Great.
hear you.
Thank you.
Thank you.
Good morning, Meg. I'm just trying to get a count of the board members who are present.
I was just doing the same thing. It looks like we have 4.
Okay. And should I wait for Mark O'Carrion or should we begin?
Well,
I think so. Let me also reach out to Julio. Is saying he's having trouble getting on. I will send you his contact information to help him troubleshoot. Let me work on troubleshooting a couple of others so we have a quorum to start, if that's okay.
Good. Thank you.
Okay.
Hi, James. Can you confirm? Can you just confirm you're on?
Yep. This is me. Yep, this is me. I'm on. Can you hear me?
Yes, we can hear you loud and clear. Great. Okay, thank you.
Great.
Jennifer, with James, we have a quorum.
I was just about to ask. So good deal. If I may just quickly ask, which of the board members are we expecting?
We are expecting everyone. Marco and Julio should be joining in the next few minutes. And I expect Steve to be joining as well.
Okay.
So we should have everyone.
Okay, well, I'm just gonna, if we can make quick calls to see if they're joining us, so we can, I'm gonna delay just another 2 minutes to see if they're coming in. And if you like, I can take a couple of calls as well as you.
I think we're good. We'll troubleshoot the last 3 and get them in. Just give us a couple minutes. The
Thank
joys of meeting by WebEx.
And to all who've joined us, both board members and attendees for the meeting, appreciate your being here. We're going to get started. I just want to make sure that we have as much of the board as possible, and we apologize for the delay. There have been some technical issues. I, once again, had technical issues, but I'm in, and I expect that others will be able to get them as well. Are we having any success?
Otto, is Julio on by phone now?
Not just yet.
Okay, but he's dialing in as he.
Yes, he is dialing in.
And Steve is having trouble. I'm gonna send you his way. Give me 1 second.
Hi, are you joining? All right, as I understand it, we now have with us Dr. Cohen, Jacqueline Sherman, Felipe Franco, James Perino. Is that correct?
Yep, I think that's right.
Okay, so we'll get underway, and I expect the other board members shall join shortly. So this is the November 9th, 2021 Board of Correction public meeting being conducted via WebEx due to COVID-19 pandemic continuing. This is a public meeting, and the meeting is now called to order. The Board of Correction November 9th, 2021 meeting is now in session. The first order of business is a vote on the draft minutes for the October 19th, 2021 board meeting, which board members have received. May I have a board member move for a vote to approve the October 19th, 2021 meeting minutes?
Second.
That was Jacqueline Sherman. May I have a second?
Second.
Second.
Okay. Are there any proposed edits? Any, debate? Any questions concerning the minutes? Hearing none, I will call for a vote to approve the October 19th, 2021 minutes. All in favor, please respond by saying aye.
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 Any opposed?
James, aye.
Good deal. And I say aye. The minutes are approved for the October 19th, 2021 board meeting. As we shared at the October 19th board meeting, the Board of Corrections' current executive director, Margaret Egan, has tendered her resignation effective December 31st. Today's public board meeting is her last. On behalf of the entire board, I thank Ms. Egan for her extraordinary service and commend her for leading and serving during a most challenging time. Shortly after she assumed the executive director post, our city's jails, like all of New York City, were impacted by the COVID-19 pandemic. Ms. Egan didn't hesitate and was quick to stand up alternate but effective methods for gathering information critical for board oversight and pressing the Department of Correction to adhere to minimum standards or variances where necessary, all while keeping board staff safe from the potential spread of the virus. During this time, Ms. Egan also managed the board through the restrictive housing rulemaking process that resulted earlier this year in the passage of new restrictive housing rules and through the completion of a strategic plan to strengthen, to improve the overall functioning of the Board of Correction. Ms. Egan, I consider it an honor to have worked with you, especially during these unprecedented times. I formed a search committee for the next executive director of the board. The committee's members are Felipe Franco, who will serve as chair, Marco Carrion, and Julio Medina. With the aid of an independent search firm, the search is getting underway. As I also shared at the October 19th board meeting, my term of service has expired. This is my last public meeting. Indeed, it has been a valuable experience. As someone who's been blessed to serve and work on structural and systemic issues that keep people, particularly people of color, from getting ahead and having the opportunity to achieve, serving on the board has only deepened my appreciation of the intentional, inextricable link between race, poverty, and justice involvement, and it's intensified my efforts to do my part. Indeed, it's also been a humbling 6 years. Ever mindful of the persisting challenges that pervade our city's jails and overall justice system, the often competing concerns when it comes to ensuring safety and dignity for all persons, staff, and those who are detained, and the very real limitations of board authority and enforceability, I sought to do good. And I imagine that, like all who served and have departed the board when their terms expired, I keep appreciating all too well that there's always more to be done. I thank my fellow board members. Yes, I thank every last one of them for the opportunity to serve alongside them and to learn more about what to do and what not to do when attempting to work together to take meaningful action on critical issues that affect the lives of so many. I want to thank especially former board member and now DOC Executive Deputy Commissioner Stanley Richards, with whom I had the privilege of working tirelessly on the RMAS restrictive housing rule. Knowing that Stanley brought his whole self, experience, and compassion to the process was a great source of assurance and inspiration as we move the rule to completion and to passage. Thank you to all of the BOC staff for your steadfast commitment and work to ensure board members have the information we need to perform our roles. Thank you to all at the Department of Correction, Commissioner Schiraldi and his leadership team, the uniformed officers and COBA, all of whom helped me appreciate many varied perspectives. critically important perspectives. And thank you to the many persons who were and are detained, who I met and learned from, and the advocates who speak on their behalf. Again, it's been humbling and at times gratifying. I'm most thankful for the opportunity to have served. Yesterday and today, a story about board oversight was published, perhaps time to drop just before today's board meeting. I very much appreciate the media attention being given the crises in our city's jails, and I want to acknowledge the board member who made the story possible. Thank you. You know who you are. Unfortunately, because of its crafted message and narrative, the story does not even begin to provide a complete and accurate accounting of the many efforts undertaken and the countless hours given by BOC leadership and staff to raise publicly in board meetings and letters, and in meetings with the department and City Hall, our grave concerns about the tragic deaths, staffing challenges, and relentless focus on decarceration, or the limitations of our authority and the various strategies and tactics employed to move the city on these and other critical issues. Nevertheless, the story does serve a purpose, one purpose, drawing attention, and that is important. Today, we will hear presentations from the department on the state of the jails and their plans to implement the board's new restrictive housing rules, ending solitary confinement, which was per minimum standards to have been implemented November 1st of this year. However, on November 1st, the mayor issued an emergency executive order suspending the board's minimum standards governing the risk management accountability system, which ends solitary confinement. The board is extremely concerned about the delay of this important policy reform, and we're eager to hear the department's detailed plans for implementation. The board is also greatly and gravely concerned about mayoral use of executive orders to suspend the board's minimum standards. Doing so fundamentally undermines the board's already limited authority. This is deeply frustrating. It's a deeply frustrating reality that the board's power is not comprehensive. We are an oversight and regulatory body. We are not, sadly, an enforcement agency. Our regulations and oversight can guide and shine light on the challenges in the jails, which the board has done ably for years. But when the Department of Correction or Correctional Health Services defies those regulations, the board has little resource beyond publicly expressing our concern collectively and individually as board members, as we've sought to do. I now want to address the current conditions in the jails. The board remains deeply concerned about the conditions for people in custody, DOC staff, CHS staff, and all others who are working in the jails. Since our October meeting, 2 people have died after receiving a compassionate release. A 64-year-old man died at Elmhurst Hospital on October 15th of this year, and a 58-year-old man died at New York Presbyterian Lower Manhattan Hospital on October 18th. The Board of Correction has begun investigating these deaths, and we send our heartfelt condolences to those persons' families and friends. Significant numbers of Department of Correction staff remain on sick leave or restricted from working with persons in custody, creating unsafe conditions for both staff and detained persons. There's an unfair burden on those whose work is not easing up, and the unacceptable delays in providing essential services, including medical and mental health services, to persons in custody. All of this has worsened. While we are encouraged that the population of people who are detained has fallen, it remains near pre-COVID levels. The board continues to call on criminal justice stakeholders, the mayor, judges, district attorneys, defender organizations, the New York State Department of Correction and Community Supervision, and the department to take immediate steps to reduce the jail population. As long as the population remains high and the staffing crisis continues, persons in custody and those who are there to protect and work with them are in an impossible position, and these troubling conditions will persist. The board calls on the City of New York to continue to move with urgency to create a safer environment for all in the jails, staff, and persons in custody. The public advocate, Jimani Williams, has requested time to address the board. And so at this time, I ask the public advocate to come forward and to present to us. Thank you.
Michael, do we have the public advocate with us? Jennifer, if it's okay, we may have to come back to the public advocate. I don't know that he's logged on yet.
Good deal. So the next item on our agenda is an update from Commissioner Schiraldi. Please begin, Commissioner.
Thank you, Chair Jones Austin, and I want to say a few words of thanks to you, to Commissioner Jim Perino, and to Executive Director Meg Egan for the work you've done. Board citizen oversight of total institutions like Rikers Island is a much neglected field, in my opinion. Not far too many places don't have such oversight, and that makes places like Rikers Island impenetrable. While no oversight body and no department head are ever going to be perfect and completely transparent, I think Justice Brandeis was right when he said, when he wrote that sunshine is the best antiseptic. We need that antiseptic here. You provide that antiseptic. You and Jim particularly have done so for free, but you, Jim, and Meg have worked incredibly hard to push this department in the right direction, and I appreciate the work you've done over the years.
Thank you.
I know a number of items on the agenda, and we'll be sure to provide updates in all of those areas. I just wanted to give some overview of some of the more hopeful things that have happened since our last meeting and over the last few months. We have a lot of work to do here. Please, 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 no one thinks that I am saying that we're spiking the ball in the end zone by saying what I'm about to say. We are not. We know we have a lot of work to do, but also I think that we need to move men's and women's souls if we're going to achieve the kinds of profound reforms we want to achieve here, and part of that is providing some level of hope. And so that's what I hope to do with the next few remarks I'm about to make. So I'm going to start with staffing. We still have a difficult challenge with staffing, but from our peak of 1,789 uniformed staff out sick on September 13th, we're now down to 1,474. Friday, that was the number. It's a decline of people out sick of over 300 people. If you look at our AWOL numbers, we've had a 61% reduction in the number of people AWOLing. That means not coming to work and not calling in. Since September 1st, remember in the middle of September, the mayor issued an executive order allowing us to suspend people for longer periods of time for AWOLing, and that's had its dramatic effect. So between those two, reduction in AWOLs and a reduction in the number of people out sick, along with a lot of staff redeployments that Chief Stukes and his staff have engaged in, this has largely allowed us to isolate triples to AMKC. If you look at our 5 large facilities, this is especially significant given that in September we reopened EMTC, so we're able to reopen EMTC, which required the deployment of hundreds of staff, and still largely isolate triples to AMKC. This has also allowed us to reduce the number of unstaffed posts we have. Looking at the data, we've seen a trend line reduction of 53% in unstaffed posts since September 1st. Even more promising, in the past week, we've seen a number of 0 unstaffed posts, including a day, November 2nd, when we had no unstaffed posts. I want to be clear that when I say unstaffed posts, all of those unstaffed posts are now being staffed. By the end of each tour, we give data on whether posts are or are not staffed at the beginning of the tour. And more help's on the way soon. 64 staff are going to graduate from our first class and start working on December 27th. Another 24 will graduate from our second class and start working on January 13th. Further, DCAS administered a correctional officer's exam from October 27th to November 1st, which 1,614 individuals passed that exam. A new class, including that 1,614 individuals, will start training on December 16th. So more help is on the way. When we look at vaccinations, we also see a promising improvements in our staff vaccination numbers. As of yesterday, 92% of our non-uniformed staff have at least one dose. That's nearly a 20-point increase from just prior to the mayor's October 20th announcement that mandated non-uniformed staff get vaccinated by October 29th. Additionally, 57% of our uniformed staff have at least one dose, which is also an increase of 10%, or 778 staff since the mayor's announcement. So that means in total, 1,000 more DOC staff now have at least one dose of the vaccine versus before the mayor's 10/20 announcement. Regarding vendors and volunteers, 85% of our vendors and volunteers have provided documentation of vaccination. 4% have asked for reasonable accommodations. 11% have not provided documentation of vaccination, and therefore they're not allowed on site. Later in today's presentation, CHS will provide some further good news about the significant decline in infection rates we're seeing amongst incarcerated people here. To services, having more staff return to work allows us to continue to improve service delivery. As the board knows, a number of services were impacted throughout the pandemic, still are, many of them, which we've worked hard to bring back in recent months. We resumed congregate religious services in a limited capacity in June, but expanded to full capacity in early July. Similarly, our in-person visits resumed in June, and we were able to complete over 7,000 visits since reopening. We were additionally able to complete over 30,000 televisits since the start of the year, and we continue to make televisits an option for visitors who prefer that opportunity. We continue to produce people for court as the courts reopen and increase their capacity, and we're committed to working through any remaining challenges in court production. We produced over 3,000 people to court in both September and October, which is a big increase from just earlier this year when we were producing fewer than 1,000 people to court each month. Of course, we continue to facilitate virtual court appearances as well. We produced over 18,000 people to virtual court so far this year. That said, there is no question that our staffing issues are affecting our ability to produce people to court in a timely manner. We know we have more work to do. We're very much committed to doing it. Finally, violence and use of force indicators. I want to share some promising indicators we've seen in terms of fights and use of force going back to May. In that time, our use of force rate is down by 18%, but the rate of use of force for level A uses of force, which are uses of force that require medical attention, is down 44%. That's since May, and that's a rate. The rate of fights among people in custody is also down 11% from May. Overall, our population is down 2% since May and down 11% since our recent peak on September 13th. I couldn't agree with you more, Chair Jones-Austin, that reducing the jail population is paramount, both to our efforts to reduce infections, but also to our efforts to, staff this place in a way that that we'd all like to see it staffed. I'm going to just turn it over quickly to Dana Wax, Chief of Staff, who's going to address the issue of sexual assaults. Any assault and any sexual assault, period, on staff or anybody is unacceptable, and we have no tolerance for it. We need our staff to feel safe when we come to work, just like we need people in our care to feel safe in our facilities. Every staff deserves that right to feel safe and respected in the workplace. I want to turn it over to Dana, who will give you some just quick overview, and then we'll move on to wherever you want us to move on to.
Good morning. I'm not sure that you can see me on the screen. I'm a little bit at the end of the table, but I'm here. Good morning, board. Sexual assault and sexual abuse in our jails, and especially where it's concerned correction officers, is a serious issue that, as a woman and as chief of staff of this department, I take personally, and I remain committed to addressing. Since taking this post 5 months ago, I've been working closely with COBA on what is a chronically underaddressed and underreported issue at the department. In the past 5 months, we've taken several critical first steps to begin to address this area and bring support to our staff. These changes include having realigned CIB under the Investigations Division and under a former sex crimes prosecutor, Serena Townsend. We've added sexual assault metrics to our teams meeting to center the issue of sexual abuse in all leadership safety conversations in our jails. And we are working with partners like the Mayor's Office to End Gender-Based Violence to bring much-needed resources to staff. As the board may be aware, DOC is working closely with the Mayor's Office to End Gender-Based Violence to implement Mayoral Order 85, which was just signed earlier this week, which will enhance trauma-informed support for all city employees experiencing domestic and gender-based violence. NGBV is creating a New York City domestic and gender-based violence workplace policy, establishing standardized trauma-informed responses for survivors of domestic violence and gender-based violence that will be incorporated into all existing workplace violence prevention programs. DOC will actually be working with NGBV to get special early access to these services this month. We are not waiting for the end of the year when this EO goes into effect. We will be able to bring services to our staff immediately. On October 24th, the department released teletype that highlighted additional services that are available to staff who have experienced sexual abuse or sexual harassment while at work. We've also created a special distribution list that will allow staff to discreetly report, which will allow staff to discreetly report sexual assault or sexual abuse they may have faced to EEO and CIB simultaneously. As I said, this is a critically important issue to the department and something that we are committed to working on in the months to come. Happy to answer any questions you have now or later on in the meeting.
I will ask the board if they have questions that they'd like to ask of the commissioner and Dana and other members of the leadership team at this time, or if you're okay with deferring your questions because the public advocate has joined us. Is there anything that must be asked in this moment, or are you good with first hearing from the public advocate? Okay, hearing nothing from the board, seeing no hands raised, I am glad that the public advocate has joined us, and I invite Public Advocate Jimani Williams to come forward and present to us at this time. Sir, we see your name but cannot hear you. It appears you're muted. Do we need to unmute Public Advocate Williams?
All right, can you hear me now?
Yes, sir.
Right.
Thank you for joining us.
All right, here we go. Got it to work. All right. Thank you so much. Peace and blessings to everyone, love and light to you all. As was mentioned, my name is Jimani Williams. I'm the public advocate for the city of New York. Thank you to the board for giving me the opportunity to testify. There have been 14 deaths on Rikers Island this year so far. I've made repeated visits to the island, I believe probably twice this year. I've witnessed the horrible conditions that exist there earlier this year, of course. And then when I went in September, it had gotten so egregious that it was almost incomprehensible how bad it had gotten. These conditions, I know, helped lead to 14 avoidable and heart-wrenching tragedies. People in custody of the Corrections are simply not having their basic needs met. I haven't gone in a couple of months. I'm hoping to visit again soon. When I was there are going days, sometimes weeks without showers, functioning toilets, medication, medical attention, just to name some things. Quite simply, it was, and I imagine still is, a human rights emergency. Again, it is incomprehensible to me that the administration believes the way to fix these issues and prevent a 15 death is by eliminating the minimum standards of living for the people that are housed there. When quite frankly, when I visited, everybody agreed on all sides of this argument that the lack of minimum standards was one of the primary drivers for the increase in violence to begin with. Emergency Executive Order 279, which the mayor issued on November 1st, without any prior notice to the BOC or the other stakeholders, will not remedy the crisis condition of Rikers. It most likely will exacerbate them. It should be terminated immediately. I have to say, it's even more egregious that we got to this point because of the failures of this administration. Abject failures on running Department of Corrections, particularly Rikers Island. And we've seen this so many times around violence, quite frankly, whether it's inside of jails, outside, on the street, in schools, where many things that many of us ask be put into place to try to address the violence before it occurs are either ignored, put in with much resistance that they can't really get implemented or structuralized. And then when it gets so acute, we rush to the punitive measures that we were all fighting against to begin with. The executive order suspends minimum standards, which guarantees the right to 14 hours time out of cell. Successfully administering this provision is fundamental to the city's goal of more humane rehabilitative jails. Without the ability to move beyond the confines of their cells, the physical and mental well-being of detained people will undoubtedly suffer. Most folks agree that this type of solitary confinement can be called torture. The order additionally removes all restrictions on solitary confinement by suspending minimum standards. In the written testimony that we'll put in, they'll have the subsections there. Under the policies that are currently active, a person in custody can be placed into indefinite solitary confinement for 24 hours a day without any process to evaluate whether or not a disciplinary infraction occurred. I can't even imagine in what world this would be allowed. As I've stated before this board many times, solitary confinement is an inhumane and ineffective way to address behavioral problems. It is an abuse for all, a death sentence for far too many, and it should be abolished in New York City. Its reinstitution via the executive order is erosion of insufficient but tangible progress that so many people were here today fought to win. This development is particularly egregious given that the mayor has vocally condemned the practice and celebrated its purported end. In the face of this misguided and harmful order, it is clear that the City Council must act expeditiously to pass into 2173 to truly end solitary confinement. I am proud to be a co-prime sponsor of this bill. This administration, the mayor, should be embarrassed for their failures. And now, because of those failures, lazily trying to push forward something that's condemned for so long. I want to take a moment to acknowledge those who may argue this executive order is needed to protect the safety of correction officers. I have been very clear the conditions that they have had to endure over the past few months and years actually are completely unacceptable. And I doubt staff would have been subjected to them if they were not predominantly Black and brown and predominantly women, particularly concerned by recent reports documenting horrific patterns of physical and sexual assault, particularly to our women who are on the job. In addition to making Rikers a safe place to live, we must make it a safe place to work. And I agree, there has to be accountability for physical assault. There has to be accountability for sexual assault, even while in jail, even against corrections officers. And so we have to find accountability. We sometimes have to find separation for problem people who are housed there, but that cannot include isolation for days on end without any due process. This executive order is not how we get there. As I've seen firsthand, when people do not have their basic needs met, that is when behavioral issues begin and worsen to erupt in mass. Ensuring that people have the ability to move beyond their cells during the day and implementing proven common sense alternatives to solitary confinement would create a structured and stable environment that would benefit both staff and people who are housed there, incarcerated people. Further depriving the entire jail population of basic rights and subjecting those accused of disciplinary violations to physical and psychological torture does the opposite. This executive order will worsen the disorder that has plagued DOC facilities in recent months. Instead of retreating toward the most punitive policies possible, we must be centering our efforts to end this crisis around incarceration. In order to further the health and safety of staff and those housed there, we must get as many people off the island as possible, as quickly as possible. Actions that match the scope of the successful population decrease at the height of COVID-19 can and must be taken. In the strongest term possible, I urge the governor, the mayor, and the district attorneys to comprehensively use all of the tools at their disposal to shrink the jail population. That includes getting people into pretrial programs. It is proven that it is better to get people into pretrial programs off the island that help get their lives better than keeping them in a cage where they get no programs at all. I also say we do have to make sure that correction officers believe that their safety is of utmost concern. So there has to be accountability. The doors should work when people are closed in their cells. We should constitute as many sweeps as possible so we can get contraband out of the housing areas. But we should center decarceration. We should also agree that a vast majority of people on Rikers have mental health issues, and people who have mental health issues should not be in jail. Rikers Island is probably the largest mental health institution in the country. There are things that we can be doing, but it takes work. Laziness to address that work should not allow us to reinstitute torture. It seems almost worse than it was before. And especially doing this on the way out the door, 2 months left, is at the height of I don't know what, I can't believe what I was reading. I really hope we reconsider this. I really hope we get Danny Drum's bill passed. And I really hope we take as much time as possible to come to the table with advocates and with corrections officers who, although they're not sentenced there, can go home, are working in deplorable conditions. We understand that they must come back to work. Even hiring officers won't help us because it takes months for them to come on board. But I do understand that we have to show them that we care and are concerned about their safety. We want to make sure there's accountability for everyone, officers, people who are incarcerated, when there's physical assault, certainly sexual assault. We also need to make sure that minimum standards are met. We also want to make sure that people who are waiting sentencing are not there for years. They either need to go home or they need to go upstate. So we should all be pushing the court system to be moving things much faster. And just on the outside, when all things failed, we often send police in to try to solve all the problems in the back end. We see a similar activity happening here with corrections officers, and everybody is suffering because of that. Thank you for this time and consideration. I really appreciate it.
Public Advocate, we greatly appreciate your coming and speaking to these issues, and we share your sentiments and your concerns. Thank you very much.
Thank you.
Chair Jones-Austin, may I just make 1 or 2 points based on the presentation by the public advocate?
Please.
So first of all, I share your concerns about conditions here, and I absolutely support the notion that we need to be working to reduce the number of people who are incarcerated here, and also to create an environment where both people who work here and people who are incarcerated here feel safe and respected. Just as to the executive order, it just moves the deadline to implement RMAS. I think there's a lot of misunderstanding out there about it. It does not change our fundamental mission to end punitive seg and create a safer, more humane justice system. We know there's been concern that the department will use this order to make changes to our restrictive housing systems and further restrictions for people in custody. We have no intention to do so All of our policies pertaining to due process and out-of-cell time will remain fully in effect until RMAS is implemented. There's no rollback in our current operations whatsoever. We cannot, per state regulations, lock up people in general population in their cells without due process, and we cannot lock people in punitive segregation in their cells for 24 hours or indefinitely. Our intention is to get RMAS up and running before the end of this year, but even if we did not, which is our intention, we still could not do many of the things that folks have been saying is possible under this executive order, and I just wanted to make that clear.
Thank you so much. Was that the commissioner?
Yes.
Thank you so much, Commissioner, and I appreciate the time that we spent while I was there. And I actually also appreciate many of the things that you've been trying to push. I do feel that they are kind of midterm policies that I think going to take some more time to develop. I will say, you know, with the administration as a whole, trust is a big issue here. How this executive order came to be without much communication that I'm aware of. The stakeholders also helps devalue some of the trust, and how we got here, even before you were made commissioner, is also trust is an issue. So when we see these things happening, it's hard to believe that it won't extend for a longer time period than people are saying. And we have a new administration coming in, not sure what that administration take is going to be, but doing this on the way out, you know, is of a concern.
Yeah, no, I hear you, public advocate. I'm trying to regain that trust as much as I can, but I do understand that it is difficult for people to trust us sometimes, given you know, how many decades, not years, not months, but decades, this place has been subpar. I'm going to try my hardest. I know my team is going to try their hardest to make it the kind of place that we can all be proud of, and during that time hopes to regain trust. You will see what we do with RMAS. I wish I had enough staff to implement it by November 1st. I just didn't. And as we push to get more people to come to work and to bring more people on, not only will we be able to implement RMAS, but we hope more programs and safer and more decent place. That's the only way we'll ever gain trust, is not by saying words, but by proving stuff. And I appreciate you coming out, and I appreciate the press conference we held together, and the fact that you've continued to shine a light on this place. I just wanted to say some things about just the realities of the laws around RMAS, because I know that some folks have put things out that I just don't think they're fully accurate, but I know we've got a big trust hole to dig ourselves out of, and we're committed to doing that.
Thank you so much. And on behalf of people I know and people who have been on both sides of those bars, we have to consider that they actually come from the same communities and very often are put in these situations that are harmful to both. And as I mentioned before, I think if they looked a little differently, we wouldn't be in a situation to begin with. So, thank you for that.
Thank you both. Are there board members who have questions or comments in response to our public advocate, what he's presented? Okay. Well, again, I want to thank you, public advocate, for taking the time and giving attention to this critical issue. Thank you so much.
Thank you. Peace.
Take care. Our executive director, Margaret Egan, will now present on the state of the jails.
Thank you, Jennifer. And before I start, I want to thank you for your incredibly kind words earlier. It has been my honor to work with you. And thank you for acknowledging our incredible staff. We are a small but mighty team that has worked incredibly hard over the last 2 years to shine a light on what is happening in the jails, and they have done great work. And Commissioner Schiraldi, I also want to thank you for your kind words. It has been a pleasure to work with you, and I hope to work with you in the future. In terms of the state of the jails, the commissioner and his team covered much of what we wanted to cover in this section, but we want to make sure that we are giving time for board members to ask direct questions on each of these issues. As Jennifer said earlier, we remain deeply concerned about the staffing crisis that is leading to troubling conditions across the jails, including the provision of medical and mental health care, creating unsafe conditions, and interrupting access to mandated and other services. So what we'd like to do today is focus on 5 areas: decarceration, intake and new admission housing, the move of women to Bedford Hills, incidents of sexual harm against staff, and the impact on minimum standards. So to start on decarceration, Commissioner, you mentioned continuing to work on decarceration. Is there a specific update? Are there specific steps that the city is taking? And then I'll open it up to board members for their questions.
Meg, the commissioner had to step out. We'll be happy to answer any questions from the members on this section, or any of the sections in the state of the jails agenda item.
Okay. Any specifics on decarceration? Any changes there?
Hi, Meg. This is Chief Stu speaking with regards to de-incarceration. As noted previously during testimony, our population is down from September from 6,028 down to, as of November the 1st, 5,444. 185 individuals incarcerated on technical parole violations with no new crime were released immediately after the less is more was signed. An additional 70 individuals released on November 1st, totaling of 255. Going forward, the law restricts the use of incarceration as punishment for technical parole violators. Instead of automatic detention for parole violators, the individual will be issued a notice of violation to appear at a hearing. 146 individuals serving sentences of less than 1 year have been transferred to state facilities. We also began transferring approximately 230 women to Bedford Hills Correctional Facility on Monday, October 18th. The department has transferred 35 women to Bedford Hills as of November the 1st. Lastly, improving our court reduction to facilitate case resolution. We are working with the courts to streamline our system for producing people for trial and other in-court appearances. As the Commissioner stated earlier regarding our in-person production in our telecourts, we also installed a video court booth directly in housing units so that people don't need to be escorted to the video appointments. The governor's executive order allows pleas by video court will continue to reduce our population. And we're also working with Mark J. to identify individuals eligible for work release.
Thank you for that.
You're welcome, Meg.
Meg, would you like us to pause here and see if there are any board questions, or do you want to continue through with?
No, I think we should pause here and see if there are questions. Felipe, did I see your hands raised?
Yeah, a question to the Department of Corrections regarding the incarceration. Can you speak particularly about the women who are being transferred to Bedford Hills and what efforts have been done? I'm particularly concerned that I believe there were 7 pregnant women, maybe 12 young adults, and I'm sure a significant number of parents. And I want to learn what efforts were done to ensure or prevent them to have to be moved by the incarceration.
Hey, Franco. So all people who are at Rosie's, with the exception of certain TGNBI individuals, are going to be moved to Bedford Hills. People who have who fall into certain categories, such as pregnancy, such as certain individuals with serious mental health needs, individuals who are scheduled for an educational exam in the coming weeks are being deprioritized, and we are moving them sort of essentially to the back of the line so that we have time to work with them, with their families, with their attorneys, with the State Office of Mental Health, with Bedford to ensure that there's appropriate medical services for them and that those are already lined up before they're actually moved. But I do want to be clear that everybody will be moved. Anybody who is pregnant, as you mentioned, will have access to apply for the nursery, and in fact, I believe Chief Mills, we already had at least one individual apply for the nursery, and we're giving those women access to that application ahead of time.
Can you speak about what, again, I want to hear about efforts, about the incarceration, particularly pregnant women, parenting. I mean, New York City actually has the best national continuum of parent-child preventive programs in the nation, and I want to learn how you're working with the DA, with Administration for Children's Services, to create the right kind of wraparound services to prevent the movement of those individuals.
Sure. So we're working very closely with We're working very closely with those individuals' attorneys to ensure that anybody who can be placed into a program is moved into a program before they end up being moved to Bedford Hills. I believe when we started, and Dan, please correct me if I get these numbers wrong, but I believe when we started, there were about 230 women moved to, who were currently housed at Rosie's. There are about today 193. But we've only transferred, I believe, 55 or so. 54 women. The rest of that has been people who have left our custody. And that is because of the work that we are doing on every individual case to work with the ATIs, to work with their attorneys, to help move them out of custody before they're moved to Bedford Hills.
Again, knowing the continuum of ATIs, very few of them are actually focused and ready to do the kind of parent-child parenting support that could be so beneficial. So can you speak about what are you doing again with Department of Health and Administration for Children's Services to create those kind of supports and increase the likelihood of those people being able to stay in the community?
I mean, good morning, Felipe. We've been working with programs like Our Children, who has a mother-child program, diversion program, and other programs that support women and children. We've been working with the Women's Criminal Justice Association to identify specific services for women with children, women with children with ACS cases, to ensure that there's a continuation of connection and services for those women, and really trying to support off-ramps for them. Our goal is not to transfer all the women up to Bedford. Our goal is to focus on decarceration and providing pathways for women to be enrolled in community-based programs where they can get their services and needs met, So we've been working really hard with those community-based organizations. We've been working with MOCJ to provide opportunities for women to be diverted, specifically women with children and women who are pregnant.
Thank you.
Thank you for that. And I just wanted to follow up on that first by commending those efforts and urging you to continue and to the extent possible, amplify those efforts. I also wanted to hear you speak a bit to the long-term plans with respect to the women's population. Completely appreciating that you've been faced with a very, very difficult situation and hearing about the efforts that you're taking to maximize decarceration and community-based solutions and supports. I appreciate that there have been no easy answers and support the short-term decision to move some of the population to Bedford Hills. What are you seeing as the long-term solution to the challenges face with respect to the women's population. What are the long-term plans for women? And could you speak a bit to what that long-term, what the timing looks like and what the challenges are?
Thank you for that question, Board Member Sherman. It's my hope that this can serve as a pivot point around incarceration for women. I would like to never see these women come back to RMSC. The city's policy is to close Rikers Island and move everyone off. This could be a really good time to start that. It was born of an emergency, but, as Rahm Emanuel said, never let a good emergency go to waste, right? And so I know the Women's Criminal Justice Alliance, with whom we've been working very closely during this period of time, has called for Rosie's, if you will, to close, the Rose M. Singer Center to close, and for women to be housed in a community-based correctional facility in New York City. I think that's a good idea. I think that if we could do that, we could really use it as a moment to create the kind of incarceration experience that we want to, which would include substantially reducing the population of women who are in any kind of locked custody at all, to making the day-to-day reality inside a facility way more programmatic so that people are productively occupied for a really serious portion of their day, and that we start thinking of return to community from the minute somebody walks in the front door. I think we could do that with WCJA and many of the excellent service providers, and it would really kind of go to Board Member Franco's question as well, which is how do you really sort of create a humane, decent, not only experience while incarcerated, but handoff back to the community where there's the kinds of supports that are going to help people thrive when they return home. So my hope is they never come back. My hope is that we find another place that's a decent place to put them, that there's fewer of them in it, and that's way better than what we've done here. And I say that knowing that RMSC is actually probably one of our better run jails. We can still do better, even though RMSC is one of our better run jails. So that would be my hope as to what comes next and what the longer term plan is. I think that fits quite well with the with the efforts to close down Rikers and these more community-based facilities.
Mr. Shirali, I thank you for that response. And again, thank you, Chief Stokes, for being so gender conscious about your efforts. Again, the same way that the city can bring their power together to create an executive order should be used to bring their power together, Commissioner Shirali, to again tap into the largest nurse visiting service in the nation, into the Department of Health, and the largest array of mother-child programs in the nation under ACS. So I'm hoping that a very comprehensive solution could be put in place.
Thank you.
I'd like to follow up with a question originally asked by Meg about overcrowding and decarceration, and then ask a question about the women. What you describe for decarceration is, I think, misnamed. Moving the women to Bedford is not decarceration. As you described, another plan would be to move them into the city, into a non-custodial setting, but that's not what's happening right now. So that doesn't count as far as I'm concerned in terms of decarceration. The men that who are serving misdemeanor sentence or you sentence to state prison is not decarceration. It's just kicking the can down the road. It's very important to remember that a year ago, the population was what it is now, 5,500, and within a month, it got down to 3,750. The city can do it. It's not doing it. It's led by a commissioner of police who wants to have more people in jail and says every person who leaves jail is a criminal and will commit crimes, and no one should be let out of jail, and more people should be put into jail. This was not the program that de Blasio came in with, and it's It's a shame that it is the program that he's leaving with. On the women, for people who are pregnant right now and are involved in medical care in the Health and Hospitals Corporation, CHS, will they continue through the delivery and postpartum process in the city rather than in Westchester?
Hi, no, women who are pregnant will be transferred to Bedford. We are working with Bedford Hills to ensure that they have continuity of care and services, just like anybody who has any sort of medical or mental health condition who is being transferred.
But not continuity of care with the doctors and nurses and midwives, doulas who they had at Elmhurst.
That's correct, and also correct for anybody who has any kind of health or mental health concern.
And what nursery will they have access to?
They have access to the nursery at Bedford Hills. We've already spoken to them about nursery services there, and I believe at least one person has already filled out an application for the Bedford nursery.
I understand that the policy at Bedford Hills relative to the nursery is to not allow people in the nursery if they've been involved in an ACS event. It doesn't make sense to me, since they're in a totally controlled carceral environment, to deny them access to their children, but that is the Bedford practice right now. What will the practice of, and it has been the practice in New York City also at times, what is your understanding of the access of women, children to women and children to the nursery if they have an active ACS case?
I need to understand their policy better and get back to you on that. I don't want to misspeak about DOCS's policy, so we can certainly follow up with you.
Okay, I appreciate that. For TGN, CNB people, are they going to go to Bedford? Are they going to stay on Rikers? What is your plan for? Are they going to a men's facility? What is your plan going forward?
Sure, and I really appreciate that question and the opportunity to provide information to the public, because I do know that this has been an area where there's been concern and some misunderstanding. So TGN BI individuals will have the opportunity, who are currently housed at Rosie's, will have the opportunity to be transferred to Bedford. Our TGN BI staff have spoken with all of those, with anyone who identifies as TGNBI at Rosie's individually, spoken to them about the program at Bedford, and worked with them to assess what their personal safety concerns might be, as well as where they feel safest housed. It's always been DOC's, for the last few years, it's been DOC's policy that TGNBI individuals have the right to let the department know where they feel safest. People who affirmatively let us know that they feel safest at Bedford Hills will be transferred. And they will be transferred to Bedford Hills. They will not be transferred to a male facility. People who tell us that they don't feel safe at Bedford Hills will remain at Rikers. They'll have the option to be housed in a male facility, in what remains of a female facility. They will continue to have access to both, which is in keeping with our current policy.
Thank you.
Are there other questions at this time?
Is May continuing with her report?
I'm going to ask her if she's going to continue. Thank you, Bobby.
Yeah, thank you. I think now we will, I think we've covered Bedford, which was another topic that we wanted to make sure we covered. I think we'll now turn to the incidents of sexual assault against staff. Dana Wax presented on this in the commissioner's update. I want to make sure that we open it up to board members for questions on this topic. Other questions?
Okay. I would anticipate that this is an area that will be closely monitored, even more closely, and we'll just have to make sure that the staff is in place at the department, at the board, as you leave, Meg, to ensure oversight of this particular issue. It's just another added to the plate.
Absolutely. The next issue is intake and new admission. We've seen some improvement at EMTC in that there hasn't been a 24-hour violation since the department reopened EMTC. But we are still seeing significant and troubling disruption in services for those who are housed at EMTC during the quarantine period. This has included challenges in providing access to medication, food, supplies, other services. So I, again, want to open it up to board members for questions on this issue. Any questions here? Okay. Then I'll move on to the provision of medical and mental health care, including self-harm and suicide prevention. At our last meeting, DOC and CHS provided an overview of their work to address the increase in suicide and self-harm, and so we wanted an update on that work and an update on any progress. We have also requested that CHS Chief Medical Officer, Dr. Ross McDonald, appear at the meeting to discuss his publicly stated concerns on conditions in the jails and CHS's ability to provide care as a result of those conditions. So I think first, if we could get any update on progress around reducing incidents of suicide and reducing incidents of self-harm, and then I think we'd like to turn it to Dr. McDonald.
Great. Good morning. As Meg mentioned, the department provided a detailed summary of its initiatives and actions concerning suicide prevention over the approximately last 2 years in the last meeting. This included the creation of a new suicide prevention and intervention policy, the revision of a constant supervision policy that expanded the definition of constant supervision, and 3 suicide prevention teletypes with the last dated September 27, 2021, which again reinforced the department's expectations for their staff and commitment to the initiative of moving suicide prevention forward within the department. We have also outlined several meetings and sessions that we've had with facility leadership, including wardens, deputy wardens, and assistant deputy wardens, the creation of a reference binder by the chief of the department's office, which included reference materials regarding suicide prevention, regarding the department's requirements to take action to prevent self-injury, and the interest in expanding the SPA program. We also included the plans for the inception of the Suicide Prevention Task Force, which included representation from the department, CHS, BOC, and key community stakeholders. Since last month's meeting, these are the following updates as relates to suicide prevention. We did have our initial meeting on October 28th of the Suicide Prevention Task Force. We are tentatively scheduled to meet again on November 18th, and we're planning about a 3-week cadence in between meetings. We have expanded our total number of SPAs system-wide to 95. That's as of yesterday. Our quality assurance unit conducted a suicide prevention infrastructure assessment in the department's intake areas, looking for potential risk points, and our FMRD department is actively addressing the identified areas. And lastly, our correctional academy will be conducting suicide prevention and intervention refresher training, which is a 2-hour training for ADW's captains and correctional officers, which will commence on November 16th, 2021. Chief, do you have anything further to add?
Again, good morning, everyone. I would just like to add, with regards to the binders that was provided to all the facilities, It is a daily reinforcement and reading as it pertains to prevention of self-injurious behavior and identifying it. Staff is reminded each day at all of our roll calls to ensure that they take all acts of self-injurious behavior very serious. They does not have the authority to make an assessment to determine whether the person is acting in a manner to gain attention or whether it's manipulation or goal-oriented behavior. That has been a focal point, and with regards to these briefings, they will be continued to be read at roll call and during facility staff meetings, and to further notice in our efforts to ensure that staff clearly understands that they have the responsibility to act immediately when they observe persons in custody acting or engaging in self-injurious behavior.
Are there do board members have any comments or questions that they'd like to ask at this point?
Yes, Chair. This is James Perino. I have a question for the department. I know this used to run me a lot of money when I was a warden, but when mental health would put someone on a suicide watch, I would have to put an officer to sit in front of the door and do a 15-minute assessment, fill out the paperwork, and then relieve that person on the next shift, until the suicide watch was taken off. I was wondering, with our crisis that we have now, is that policy still in effect, or how do you accommodate that? I guess that's a Chief Stoops question.
Yes, hi, James. Thanks for that question. That policy remains in effect. Whenever a person is placed on enhanced suicide observation, it is still our responsibility to ensure that once notice is given to the control room supervisor that a person has been placed on enhanced suicide observation, that a correction officer is assigned to observe that person either while they're in the intake or until they are transferred to their designated housing area.
So even though when they're in the housing area also, right, like a cell area, you'll still keep that officer, that one-on-one on the officer?
That is correct. I'll just give you one occasion that we had recently. We had deployed several staff members to a facility that had a number of persons on enhanced suicide observations. And during the course of the day, it was between 20 and 20 officers that we had lost that we could not place on persons in custody facing posts because each one of those staff members was assigned to observe a person on enhanced suicide observation.
Yeah, I could see where that would be a big challenge these days, but that's something that, I'm sure you can't skip on that because, God forbid if something happens. I know we were working on building doors with bigger windows, so one person could actually view maybe one or two people, possibly three. I'm not sure if that's something you still do, but maybe that's something to look at, so you don't have to waste a one-on-one where somebody can actually have a view of, two people. There's more windows where you can view. But thank you, Chief Stoops.
Yeah, but thank you. In the area that we have the large pane windows at the top and the bottom, we do to use staff efficient, and persons are placed on enhanced suicide observations. We put them side by side. That would allow us, instead of using two correction officers, to utilize one correction officer because they have a clear line of sight of both persons with the large pane that is on the doors.
Excellent. Well, thank you, Chief Stoops. Thank you, Chair. That's it.
Are
We
there
hear from
other
CHS
questions on
regarding
this particular item?
suicide.
Okay. Meg, will you proceed?
Yeah, I think now we would like to hear from Dr. McDonald and offer board members an opportunity to ask him some questions. Dr. McDonald, I'm sorry, I can't see that far. Apologies.
Hi, can you hear me?
Yep.
Hi. So thank you, Meg and Board. Just to reiterate much of what the commissioner said, we've seen the population come down. We've seen benefits from the opening of EMTC over the last few months that have really eased many of the most critical problems that we were seeing. So grateful for the progress and the collaboration from the department on that. As the commissioner said, I think nobody's saying that we're out of the woods yet, and we are still seeing the impacts of this staffing crisis on our care delivery. But the most critical elements, the intake processing, the basics of COVID control, we've been able to get a handle on, and that's very important. What we continue to work on every day with Chief Stooks and his staff is production for more routine services, medical and mental health follow-ups, dental visits, medication, and diabetic care. And we're still pushing hard on those things and seeing improvements day by day. So dramatic improvement with still a lot of work to do.
Bobby, did you want to say something? Bobby, do you have a question or comment?
Ross, could you go over the elements of your letter describing dangerous situations and let us know which of them are fixed and which of them are not fixed?
I don't know.
I think the critical elements that I raised there were primarily related to the breakdown of intake and COVID control, staffing in the clinic, the ability to staff suicide watch appropriately and to make transfers between facilities, and those critical areas we've seen dramatic improvements in. Really a lot of our attention is focused to some of the routine services that we've been unable to deliver now for some time, and trying to prioritize within those.
Do you think, did you think that 2 years ago you were meeting the Board of Corrections standards in medical and mental health?
Yes, for the most part. I mean, you and I would have disagreements about some details of that at times, but yes.
And now?
I think, the staffing crisis is affecting certain elements of care delivery for sure. And I would not be able to attest to that across the board right now.
In your letter, you describe the deaths, the suicides, and the deaths as jail attributable. I think that's a very useful term for us to understand morbidity and mortality within New York City's jails. I reviewed our initial 5-day reviews, and they included DOC reviews, and I thought they were jail attributable. Do you think the situation exists where there's likely to have another jail attributable death in the near future? You know that better than I do, but the conditions that I still hear and what didn't happen then, I'm very concerned will not happen now. What didn't happen is that people were not provided care in a timely manner, both for their suicidality and their medical problems. And could you at that point you said that I don't have the letter in front of me, but you described the situation of great concern that more deaths would occur. Do you still feel that way?
I think the likelihood of further jail attributable deaths is much less than it was. As you know, Bobby, from your work over many years, there are risks that are inherent to these settings, and absolutely those risks are exacerbated by the staffing crisis that has been well described in these meetings. I think that progress has been made with regard to safely staffing and more work needs to be done. The risk is less, but it is not gone.
I appreciate that answer. I have one last question. Do you, your staffing today, is it decreased from what it was 6 months ago? Is that because, and if it is that because of budget cuts to your program, or because the staff are not coming to work or have resigned?
Our staffing has not been reduced through budget cuts. Recruitment and retention is a critical element of our work. I'm struck by the heroism of our staff who have stuck through this crisis and continue to. And I think that our staff are starting to feel improvements, and that's critical. We've made a tremendous amount of progress in the delivery of medical and mental health care, as well as the range of services that CHS provides, everything from social work and reentry to wellness and support for patients. So we've made tremendous progress, and I think the key for CHS is for our staff to understand that we will continue to make progress. And for that, we just have to get through a period of challenge. And I think we've retained the bulk of our staff through that challenge, and people are starting to see the progress come back.
How many did you lose?
I don't have exact numbers on our attrition. We have attrition all the time, and we have new hires all the time, and I can't put numbers on it to say what's related to this.
Perhaps someone could send that to the board. Monthly numbers of people in each category over the past few years.
I guess what I'm saying is I don't know if it's knowable, Bobby. I don't think it's knowable. I think people come and go from healthcare jobs for a lot of different reasons, and COVID has changed things in the jail, but it's changed things in the healthcare industry. It's changed things in our society. What I want to be clear about is that CHS has come through this strong, and we still have the best healthcare delivery staff in any setting like this across the country. I believe that with certainty.
I'm not questioning that, and I'm not going to make a joke about Rumsfeld, but you can count how many people you have, and it matters how many health providers that you have. I mean, I wouldn't expect health providers to do what the staff of COVID, the members of COVID did, which is to leave. Your staff wouldn't leave a critical position unfilled. They would stay until it was filled. But it's harder if you don't have the number of people to do it, and if you're not able to maintain the staff. It's important for the board to know whether or not it's possible to maintain the minimum standards, that you're able to do that. So if I understand that it'd be hard to interpret those numbers, but they can be reviewed.
Yeah, I just want to be clear. So we have not had a staffing crisis on the CHS side that has impacted patient care.
Thank you.
Just an FYI, Dr. Cohen, it may just be me, but you sound uncharacteristically low. So I don't know if you want to get closer to the mic.
Okay.
It's hard to hear you, Bobby.
Okay, thanks for letting me know that.
Are there, with board members, are there other board members who'd like to address Ross McDonald?
You're muted.
Jennifer, I think you're muted.
I'm sorry.
Jennifer, can I just
I'm sorry.
speak for 1 second?
Please, I was just
Yeah,
asking if there were other board members who wanted to speak.
Yeah. Apologize, it was hard to get in. It wasn't letting me in. But Russ, it's a pleasure to hear your voice and see you. Means a lot to me.
Thanks, Steve.
Thank you. Are there other board members who'd like to ask questions of Ross McDonald or make comments? Like Dr. Safer, I thank you for coming and presenting to us. There were many questions and concerns raised by your letter, and we're grateful for the opportunity. We're glad that we have the opportunity to hear directly from you. Let's see. Are there other? Meg, I'll return to you, but we'll just go to you first, and then I'll ask a question of the board.
Sure. We have one more area, which is the provision of basic services. In the board's tours, in the complaints the board receives, and in our oversight of the department's Office of Constituent and Grievance Services, we are receiving and seeing consistent complaints on the lack of basic services. And so we would like the department to address the steps that they're taking to ensure that people in custody have access to those basic services, including, but certainly not limited to, recreation, law library, visiting, and congregate religious services. On our tours, we've seen instances of people not receiving escorts to receive medication, a lack of access to law library, problems receiving hot food and appropriate portions of food, among other basic failures to provide basic services. So just to start, if the department could comment.
Yes, this is Chief Stu speaking. As it pertains to services, as it has been stated during this testimony this morning, that definitely staffing insufficiency has created disruptions of services being provided to persons in custody. However, we take that very seriously. We have begin to provide persons in custody congregate services, allowing them to go down to the location to participate in religious services. As it pertains to recreation, we have been committed to providing all housing units in all our facility recreation on a daily basis, which is reported out as a part of our plan. As it pertains to providing hot meals to persons in custody, that we take very seriously. On the side of nutritional services, there's adequate amount of employees who provide meals to our persons in custody. And what I would do at this point is pass it off to FDC Richards to speak more on the programming piece.
Yes, good morning, everybody. We understand the relationship between engagement, services, minimum standards, and safety in our jails. At the end of the day, we want to make sure that the jails are safe for people in custody and our officers. So we have been leaning in really heavily on our program staff and with our contracted providers to provide services to people in our care. We provide in-unit recreation when we have staffing challenges that prevent folks from going out to outside recreation. We realigned our counseling services staff to assure that one counselor covers 2 units, and so we're providing basic social service resources and services to people in custody. And we have engaged our contracted providers to provide on-island services by way of group facilitation, discharge planning, and continuity of care when they get released into the community. So we understand the importance of providing those minimum standards. We understand the connection between services and safety. And as Commissioner Schiraldi described this morning, what we are keeping our eye on is making sure that people are engaged, people are getting their minimum standards, and people are getting access to resources. So at the end of the day, we have safe jails for our staff and for people in custody.
Again, I'm calling on board members if you have comments or questions that you'd like to raise with Executive Deputy Commissioner Richards. Okay. I thank the department for responding to the issues that Meg surfaced and board members asked questions about. Meg, is there anything else that you'd like to speak to at this time?
No, that's it. Thank you.
Good deal. All right, we're going to talk now about rule implementation, restrictive housing rule implementation, and the executive orders that were signed by Mayor de Blasio. Under the rules passed in June, the department was to end the use of solitary confinement and implement the RMAS system by November 1st. And when that day came, instead of implementation, the mayor issued an emergency executive order delaying the end of solitary confinement in New York City jails. We understand the Department of Correction is grappling with many challenges in the jails, but ending solitary confinement is no less an urgent matter. Today, we're asking the department to provide a clear plan to permanently and quickly discontinue solitary confinement and implement the RMAS model. Specifically, the board seeks to understand the reasons why each part of the rules cannot be met at this time, a detailed timetable for implementing each part, and a description of the interim processes being undertaken to protect the rights and safety of people in custody, correction officers, and all others who enter the jails. I will now ask the department to provide this update.
Thank you, Jennifer. And I just want to start by just acknowledging and thanking you for your service and your leadership. It has been an honor for me to serve alongside you with your steady leadership. As I served with you, there was never a voice that was too low that you didn't hear. There was never a mountain that was high enough that you took your eye off the ball. There was never a valley low enough that it knocked you off your stead. And so I just want to thank you for bringing all of you into this work. And I've had a real privilege of understanding your center and where you come from. And this city's better off for it. This Board of Corrections is better off for it. And this moment is better off for having you been part of it. So thank you for your service. Thank you.
Thank you.
I want to just start by reiterating what Commissioner Schiraldi said. We are committed to ending solitary confinement. As one of the co-authors of the RMAS model, I'm personally committed to ensuring that we have jails that are safe, humane, and hold people accountable when they violate the rules, because that is what keeps us centered as a society, making sure that we are all accountable. We're committed to making sure that RMAS is implemented by December 31st, and we have taken the steps on a number of fronts to make that date a reality. There are some other realities that we're dealing with, as you all heard, about staffing, but we are charting a course to end solitary confinement by December 31st. I want to talk about 5 overarching buckets of work that we've been doing to get to this moment. And I just want to be clear with everybody else. This moment isn't a switch. We don't turn off a switch and end solitary confinement and call it the end. We need to create the conditions through training, through staff selection, through policy development, to ensure that the RMAS model that we had envisioned to be able to hold people accountable when they violate and harm somebody, to be able to move somebody from general population, to begin to address some of the core issues that have driven the behavior. And so this isn't a switch. This is a process, and it's a commitment that the department is making as a result of the rule that the board passed. So regarding our policy, we have finalized our policy. There are 2 policies remaining that we're going to be sending to the board this week. We expect to hear feedback from the board on our overall policy. That will chart the course for us to be able to do our training and to implement RMAS. Staffing. We have developed a rich staffing plan to ensure that we just don't isolate people after an incident, forget about them, and then bring them back into population. RMAS is a system that allows the department to swiftly move somebody when an incident happens. It allows us to work with that person to try to understand the driving needs that that individual has that caused the particular behavior and to address that. And then it provides a pathway for that individual to earn their way back into general population with the expectation that that behavior will cease and no more harm will be caused. So we have a robust staffing plan that we've developed, and we're working closely with OMB to expedite the hiring of staff for our program unit, staff for our legal department, and we've identified staff, our uniform staff, to be trained on RMAS. We've developed a 2-week training module. We sent the board the training specs that would allow us to both train to policy and train to directive, but more importantly, train and give officers the soft skill tools that they will need to manage the population. We want to shift away from training to directives and training to policies and have policies be the way officers interact with incarcerated people. We want to shift that to what we call, and what's been called, a dynamic security approach. That means giving officers the tools to be able to understand the population they're working with, giving them the tools to manage crisis in the moment, giving them the tools to understand the emotional aspect of what incarceration means and what it means to be an officer, to be housed, to be working in RMAS. So we've developed this training curriculum, and we're starting training on November 22nd. And we've laid out a number of training dates that would allow us to train a significant number of officers to cover 3 tours and cover the RMAS units. We have finally got SCOC approval to do the final piece of construction on level 2 to allow us to open up level 2 and level 1 on December 31st. We have engaged DDC to help us expedite that construction, and that construction is on the way. It's happening and should be finished prior to December 24th, I believe it is. And then the final piece is attorney representation, which is a big piece of RMAS. As we built into the training for officers, we built in procedural justice. This is a huge procedural justice piece for us because this gives us the process in place to allow attorney representation during these hearings. And so we have been talking with MOCJ, and MOCJ has been engaging defender organizations to make sure that those organizations are ready to hear cases when RMAS opens on December 31st. We've ordered all of the kiosks. We're in the process of establishing the adjudication centers where those hearings will take place, where defenders and their attorneys will be able to participate, and we don't anticipate any problems with attorney representation and the kiosk setup. Having all of those pieces in place will allow us to effectively implement RMAS and implement it in the way that we had all envisioned. It's a system that moves away from punishment and isolation to a system that is built on accountability. When you commit an infraction, someone gets hurt, we're able to remove you from general population. We are able to adjudicate your case using procedural justice, and if you're found guilty, you will be separated from general population, but not in an isolated way, in a way that we can continue to work with you to identify the needs that might have driven the behavior, to stop that behavior, so when they end up back in general population, we don't see a reoccurrence. So we really appreciate the board for your commitment to RMAS. We appreciate your steadfastness in holding us accountable and make sure RMAS is implemented. and we stand ready to implement RMAS on December 31st. Thank you.
Thank you. Thank you, Deputy Commissioner Richards, for the overview of the plan. I want to take a moment to address, well, before we go there, let me just ask board members to respond to what they've heard. If you have questions or comments, we're not going to center at this moment on the executive order, but on the plan concerning the implementation of the RMAS model and the timeline. So,
Are we going to talk about the executive order?
we are going to talk about the executive order, Dr. Bobby Cohen. I'm just saying that at this particular moment, given that we just heard about the plan, the timeline to implement RMAS, I want to hear from board members, and I'd like for board members to have the opportunity to ask of the department questions concerning the plan. After that, we will turn to talk about the executive order. Are there any questions?
I have a question. Why did you pick December 31st? That's a tough day it's an easy day for a dangerous party, but it's a hard day for anything to get done. And what percentage of RMAS will be done on that December 31st? And will all of the judicial protections be in place by that day?
Short answer, Bobby, is yes. What we have done since the rule came out is really work to stand up all of the policies, the training that is needed to really be able to operate RMAS. So on December 31st, RMAS will be opening. The policies will be finished. We're going to get the feedback from the board this week. We're sending you the final 2 policies. We've ordered all of the kiosks. We are working with OMB, as I said, to bring on staff. We've identified the existing staff that we'll be able to have to start RMAS. And so the 31st is a date that we are opening up RMAS. The other thing we're doing, and Chief Stoops can talk about this, is right now we're working to look at reducing the population of people we have in punitive seg. Over the years, the number has been coming down. The number continues to come down, and we are working outside of a rule, outside of a mandate, to reduce the number of people in punitive seg. We will start RMAS on the 31st.
When will you finish it?
Can I jump in for a second? When we're saying the 31st, we're saying by the end of the year.
Yes, by the end of the year.
I agree with you. The 31st is a Friday. That is a hard day to implement anything here. If we're ready on the 27th, fantastic. We will start on the 27th. When we're saying the 31st, we're saying we fully intend to get this in place, to phase it in place by the end of the year.
Right.
I think we also appreciate that the work continues in our jail system, regardless of the day or the date of it being the end of the year. So I thank you for that. Question for you, can you share with us what how you will keep the board apprised over the course of the next 7 weeks about the implementation status and any challenges that may present?
I'm happy to answer. Good morning, everyone. This is Stephen Kaiser. Thank you for the opportunity to address the board this morning. As you know, we've been issuing monthly reports that have grown, in their comprehensiveness over time. The most recent report included additional data related to ADP. There's also a narrative component detailing all the work that happened during the reporting period. So we'll continue that. The next report will be at the beginning of December, which will be a good marker in this implementation, but we remain in regular contact with the board throughout this process. We recently, between now and the last meeting, we've sent, I believe, 7 additional policies. We've also sent all of our training curriculum, which amounted to, I think, over 10 pretty comprehensive documents. I remain available for any questions along the way. As FCC Richards mentioned, we're still awaiting feedback on the policies and any feedback on the training curriculum. So we're always open to those conversations, and of course, as we did earlier this week, and we are happy to continue engaging members directly as this progress develops.
Very good. Thank you. Yeah, we're now going to turn to a discussion about the executive orders that have been issued. I just want to state that, I'm not hearing at this particular time from any of the board members any concerns about the specifics regarding the implementation plan that Executive Deputy Commissioner Richards has laid out. Just want to be clear, and I want to be, I want to be accurate in that. It's very important to be accurate. I'm hearing nothing about questions or concerns about the plan itself to have it implemented by December 31st.
I have a question which I asked and was not answered. Will it be completed, the RMAS program be completed by December 31st, or will it only be started before December 31st? And how much will be done by December 31st, and how much will remain to be done?
Yeah, thank you, Dr. Cohen. The important thing to remember with RMAS is that, beginning the implementation, only people who go through our due process system laid out in the rules with attorney representation can be placed in RMAS. So we are envisioning a phased approach. The first approach, importantly, includes about half of the RMAS units. So on the 31st, will be available for half. Over the coming weeks after that point, we're planning to roll out additional units. But again, the idea is that we will have and we expect to have available bed space based on the need. And again, need is dependent entirely on the infractions, the findings at disciplinary hearings that will be taking place. So we believe we will have capacity as our rollout takes place over the month or in time with the 31st intention.
And you think it'll be through by January 31st? Will that be fully implemented?
So the plan, the current intention is to, by the end of January, have the entire system open, which will include the 8 level 1 units, several units for level 2, as well as units for the RRUs for both adults and young adults.
And part of our work, Bobby, this is a sort of multiple prong approach. RMAS is a strategy to address violent behavior when it occurs. Here's where we really want to go. We want to create the conditions where violence is not the rule of the day, it's the exception of the day. And there are a number of things we're doing to ensure that, right? We're bringing in programs, we are re-envisioning how we could establish the kind of culture we want, a culture that will be safe for officers, a culture that would be safe for incarcerated people. As Stephen said, we don't know what the response is going to be, the need is going to be when we open, but we'll have capacity to open. But the reality for us is we would like nothing better than not to be able to use it, because we've created the conditions where violence is not the rule of the day, but it's an exception. And we have some work to do to get there, but that's the North Star.
Thank you.
Okay, thank you. Seeing no hands raised.
Yeah, I have a question, actually.
Please.
And thank you, Stanley and others very much for the overview. I do, and I appreciate, Stephen, your inputs on the continual updating of the board. I do think for purposes of continuing to understand the sort of all of the moving parts and the steps that are being taken toward implementation on the schedule that you've outlined, it would be really helpful for the board to have a documented plan that we can reference to ensure that we understand all of the steps. It would also be helpful to have a process if the department encounters challenges that delay implementation of any of the specific steps. it would be helpful to know over the coming 6-7 weeks when those challenges occur and what the impact of those challenges will be on the overall timeline.
Jackie, we do have a draft written document. I'm happy to get something out to the board either by the end of the day or tomorrow. We'll just make sure that everything in there is exactly right for this moment, and we'll send it out to you. We can also commit to having a call based on that document with the board every 2 weeks to make sure that we're staying on track. Very happy to participate in that and make sure the board is up to date in our RMAS implementation over the next 2 weeks. I'm sorry, next 2 months.
Thank you. I look forward to seeing that document and to the updates.
Thank you.
Thank you. I am not able to see everybody clearly, so if there's another board member who would like to comment or ask a question, please join in right now. Good deal. So again, I want to thank you, Executive Deputy Commissioner Richards, for your overview and for your commitment to this work. I personally know that commitment. I do want to take a moment to address the use of issuance of emergency executive orders in recent months, and I imagine that other board members do as well. We're deeply concerned, we're deeply troubled by the administration's use of these orders to override the minimum standards and also to override the established process whereby the department or CHS seeks a variance from the board at a public meeting, and the board votes on that request after public testimony and open debate. Emergency executive orders further diminish the board's ability to provide effective oversight and to protect people in custody and staff. The people who are most affected by suspending the minimum standards are not board members, but people in custody whose legal rights are suspended and diminished. We are seeing how that creates the conditions for increased violence in the jails. It's a very troubling precedent that has been set and seems to now be used. Well, it has been used instead of coming forward and requesting variances of the board. That's very troubling. And as I said, diminishes the authority, and I say the little authority that we actually have by the way of the charter and other provisions. Are there other board members who'd like to say a word or two about the city's use of emergency orders? Dr. Cohen, are you raising your hand? I cannot tell if Dr. Cohen is attempting to
No, I
speak.
said if there's anybody else who'd like to speak first, I'd offer that because I've been speaking a lot. But if not, I'll speak.
Okay, it does not appear that there are other board members who would like to make a statement.
Okay, there was, I share the chair's concern. I assume, and you can tell me if I'm wrong, that the department asked for these. I don't believe that the mayor thought them up himself. I don't know if he was that familiar with the Board of Correction standards. I think they're very, very, very dangerous. They're, you know, periods of time in history. The board has sort of taken over the mayor's role, and you know, during a previous administration, the board reversed many of its standards, giving essentially adopting the program of the department under a previous chairman, under a previous mayor. This is worse, I think. There is no basis for an executive order continuing solitary confinement. There is no need for an executive order telling people who get hearings that for infractions that they're not going to have hearings, have infractions, and they're not going to have hearings. I heard you, Stanley. You're saying you're not doing it, but you asked for it, and you got it. And there will be delays, and there will be people going to who commit infractions right now, and you could be providing them with lawyers I'm sure that the defense bar would step in tomorrow, but instead you're making a rule that that eliminates their the ability to do that. There's going to be a new mayor. He has publicly expressed concerns, not concerns, he has publicly expressed the notion that he thinks that solitary confinement is a good idea for certain people. There's an organization who is repeatedly, who's taking an action to not send people to work, who's very committed. And one of the reasons that they have said that they are not going to work is because the board's work on eliminating solitary confinement makes the jails unsafe, and they want an end to the limitations on solitary confinement. They say they cannot function unless there's solitary confinement. And I don't know if they were present at the meeting with the mayor and the leadership of the department, but certainly their goals are very well represented within this order, within this executive order. We do have a variance position. The mayor has been ignoring it and overriding it repeatedly, and he continues the orders repeatedly. And you can try to destroy the board, and it's possible to destroy the board. This effort can only be seen as a conscious attempt to remove its authority, and I'm surprised that this department agreed to that. You could have asked us for a variance. You could have spoken to the chair and asked for a variance. You could have spoken to me and asked for a variance. There were only 7 of us or 8 of us. You could have counted the votes. You could have found out what was happening. Instead, you take an action which is unnecessary and very, very dangerous. And I very strongly support all the work that your administration, Vinny and Stanley and Dana and Chief Stukes are trying to accomplish, but this was a serious error and will have serious repercussions. And I sort of hope that you would have eliminated, there would have been an executive order eliminating some of these things today, because there's no need for them to be included if you just want to protect and delay RMAS. And you could even have just asked for the variances today. And you could have told us that you were going to ask for this executive order. There's a tremendous lack of trust right now, and you're going to be heading into an administration where you could be helped by the board, and you'll need our help. I hope we're there to provide it for you. Thank you.
Are there other questions, comments or questions?
May I respond?
Go ahead, Commissioner.
I'm sorry, if you would just give me a minute, Commissioner. I do think it's important first to hear from other board members. So if you would please just allow us that. Commissioner Franco, Board Member Franco, do you have a point you'd like to make?
Yeah, I'm also really troubled by the executive order. I mean, in a way, it wasn't necessary. I'm particularly concerned, Commissioner Shirley and others, around taking away the protections of young adults. There's no reason to do that. The executive order, in a way, makes me think that we want to go back to the days where young adults could be commingled with adults as punishment, as a way of intimidating them, which is against everything that I believe Commissioner Richards and you believe on. It actually undermines everything, Stanley, that the task force is working on. I mean, we're working on a very thoughtful document with many advocates and legal experts on how to do commingling in a way that is actually uplifting and a way of providing mentorship and helping young people regulate their emotions and behavior. And again, as Bobby said, there's no reason for this executive order. If you needed any kind of dispensation or time in your work around young adults, you could have asked for a variance. I mean, this undermines any trust on my behalf, and I think of many who actually are working and meeting with you guys tomorrow to actually see a better horizons for young adults. I'm really concerned that this could actually get back to the days that we know young adults were just put with adults for intimidation purposes. It took a long time to get where we at, and it could all go away.
Thank you, Board Member Franco. I just want to make an additional point that I think is important to note for the record and for the board and the department as you all journey onward. To be accurate, and the lawyer in me always wants to center on accuracy. I appreciate what Dr. Cohen said when he spoke to this not being the first time, but to my knowledge, since I've been on the board, this is only the second time, not repeated, in the way that it sounded, but this is the second time that emergency orders have been issued. And we have to keep in mind that the first time, given that Dr. Cohen also raised this issue of trust or distrust, the first time executive orders were issued, it was after the department came seeking a variance on young adult ESH and separation status, 2 variances, something that I believe the department felt they needed to function, and those variances, well, one was voted down, the other one wasn't brought forward. I believe that this is a response to what transpired at that board meeting where they brought forth what they felt was a variance based on need that was not approved. And I imagine, not having talked to the department, not having talked to City Hall about this, that is the basis in many respects for this emergency order now. That, as Dr. Cohen speaks to, trust has been eroded. And so I imagine, and the commissioner can correct me, but this is just my hunch, again, not having talked with anybody about why the executive order was issued, other than after the fact, I should say. But I believe it has a lot to do with a growing distrust on the part of the board towards the department and the department towards the board, which is tragic and unfortunate. But it began several months ago. Commissioner, would you like to respond?
Sure, thank you. We asked for emergency orders because it was an emergency. I came into a department where a really substantial portion of staff are unavailable to do the job I need them to do. And, it was really, today's conversation in many respects was fascinating in the sense of, we take things sequentially as we go through an agenda, but they don't occur sequentially. They occur all at once in a stew, if you will. So, we can talk about producing people for medical appointments or for recreation or for court or having enough staff to train for RMAS or to deploy an RMAS. We can talk about those things sequentially, but they don't occur sequentially. They occur all at once. So when we're opening up EMTC, because intake in OBCC is really bad, legitimately really bad, we spent those staff. We don't get to spend them again on getting people to court in time or on getting people to medical appointments in time or on suicide watch. We can't spend them twice. We can only spend them once. So when we asked for an RMAS executive order, which we did ask for, the mayor didn't just come up sua sponte and say, hey, you guys need an executive order on RMAS? Of course we asked for it. It's because we couldn't make the deadline based on really energetic efforts to get people to come back to work. And in some respects, we prioritize the opening of EMTC, right? I mean, I just want to say that out loud. Like, I'd like to get rid of RMAS. I'd like to not send women to Bedford Hills. I'd like to produce people to court appearances exactly when they're supposed to be there. I'd like to have everybody show up at a doctor's office right when they can. I just can't do all those things all at once. I do support the reduction in the population. Very, very little of that population now is sentenced. Almost everybody is pre-sentenced, and I don't really control the pre-sentence population. The mayor doesn't either. So we've dramatically reduced the number of people in SEG. It was 600 and change when the mayor took office. It's 60 to 70 now, and we're on the road to eliminating SEG. I hope we'll be able to do it by December 31st. But a whole bunch of other stuff's going to pop up between now and then. The State Commission on Corrections has got to keep giving us waivers. We've got to keep having staff show up. And when we do it, trust me, we're going to pull those staff from something else unless our efforts to get people to come back to work are just way, way more successful than we thought they would be. So, yeah, I mean, Chair Jones-Austin, you're right. I mean, there was certainly a bit of it was, holy cow, we can't afford to lose this vote, so maybe we just don't have this vote. But I don't want to act like I have a deep distrust for the board. If we had enough staff, we'd be doing this. Wouldn't have anything to do with whether I trust the board or not. Wouldn't have anything to do with whether I want to open EMTC or whether I want to have people show up at doctor's appointments or court appointments. I want all of that stuff. I can't have all of that stuff. And when I can have all of that stuff, I'm doing all of that stuff and more. So I don't know if that's a satisfying answer. It certainly doesn't satisfy me. I'm demoralized by how difficult it is to get people to do the thing they want to. We want them to do. Like, can I give you just one example? On Indigenous People Day, right, on Columbus Day, there are no courts, but our staff still report to their assigned space in the courts. We sent a bus to the Queens Courthouse to ask people to come and relieve triples that day. And 7 people dialed 911 and went to the hospital. These were people who were perfectly healthy just before that bus showed up, and they didn't come to work to relieve their fellow officers on triples. So it's a kind of, and that is not representative of all of our staff. What's representative of most of our staff is the people who come to work, even though they know they might end up having to work a triple. But I don't want us to get used to the pandemic as if it's not here. I don't want us to get used to having 1,400 staff out sick, 800 staff medically modified, and dozens of staff AWOLing every day, as if it's not a crisis. All of those things are a crisis, and that's why I asked for an executive order to delay but not eliminate RMAS. I did not mean to disrespect you. We do not intend to return to the bad old days of kids being willy-nilly commingled with adults. I think we're very carefully handling that issue with a bunch of youth advocates right now, even though we have an EO, to specifically work on when young people are or are not commingled. So I get it. That was not a good day for trust between the department and the board. I will absolutely take that one on me. I asked for this, not anybody else but me. And I asked for it because we were in an emergency, and I can't do all the things all at once I'd like to do.
Thank you, Commissioner. And I just want to make a point. I remember that there was an order on COVID, but that was not in response to what would have been a variance request. It was just the conditions of the jails and what was happening in the height of the pandemic. If there are no additional comments or questions, we're going to turn now to receive an update on CHS and DOC's continued management, handling of COVID-19 in the jails. Meg, would you please introduce this topic?
Yes, thank you. In recent weeks, the spread of COVID-19 in the jails appears to have slowed, and we're encouraged by this trend. We again reiterate our support for reducing the jail population at this time of crisis Today, we will present an overview of the COVID cases in the jail population, and vaccination. As we have been doing for the last number of months, a longer presentation, complete with key data points and trends on housing area capacity and testing, will be posted on the board's website after this meeting. In terms of total confirmed patients in custody, on November 5th, CHS reported a total of 606 people in jail, or 11% of the jail population, had or had recovered from COVID-19. 27 of these individuals had an active infection. As of November 5th, there were 373 COVID cases among CHS staff and 2,415 COVID cases among DOC staff. New staff cases have fallen for 2 consecutive months. DOC reported 63 new staff cases in October, down 14% when compared to September, when there were 73 new cases. Meanwhile, CHS reported 5 new staff cases in October, down 72% compared to September, when there were 18 new cases. Now turning to the total jail population, the first wave of the COVID-19 pandemic prompted coordinated efforts to rapidly reduce the jail population. As we've noted, by April 29th, 2020, the jail population fell to a historic low of 3,832. This trend slowly reversed for much of the latter part of the pandemic, with the jail population reaching a new high last month, peaking at 6,095 on September 14th, a 59% increase when compared to April 29th of 2020. As of November 5th, there were 5,450 people in jail, marking a 12% decrease compared to September 14th. The board is encouraged by the continued decrease in the jail population and again holds that ongoing engagement and decarceration are needed to keep people safe. Of the people who were in jail on November 5th, 5,450 were in pretrial detention, 120 were serving a city sentence, 114 were held on a technical parole violation with no open case, 216 people were in custody for other reasons. That includes state sentence, stay ready, and other categories. And within these categories, there are 770 people age 50 and over, including 30 of those who are held solely on a technical parole violation. In terms of vaccination, on April 5th, 2021, CHS added vaccination metrics to its public data snapshot. In July, CHS made a change to its vaccination reporting. Prior to July 23rd, CHS reported the total number of patients ever in custody who received the first vaccination dose by CHS and the total number of patients ever in custody who completed vaccination by CHS. On July 23rd, 2021, CHS began reporting the total number of patients ever in custody who received at least 1 vaccination dose by CHS because patients in custody are increasingly receiving 1 dose of a 2-dose regimen from a source external to CHS. Between January 7th and November 4th of 2021, CHS administered at least 1 vaccine dose to 4,143 people in custody. And the number of new vaccination doses administered by CHS rose sharply in mid-October. As of November 4th, 43% of people in jail had received 1 vaccine dose, and 37% of people had completed vaccination. I will now turn it to DOC and CHS to provide any updates.
Hi, I guess, Commissioner, I'll start. It's Patsy Yang from Correctional Health Services. Thanks, Meg, for recapping our data. The update right now is that there's 25 patients with active infections in the system. Over 98% of our staff are vaccinated. 43.3% of our patients who are in custody are vaccinated. That obviously doesn't tell the full picture. Almost 4,200 people who have been in custody have been vaccinated by us. The percentage stays a little bit lower only because people thankfully get out of jail and go into the community having been vaccinated by us. That's a great thing. The status of COVID in the jails continues, as our data, as Meg presented, to go in a hopeful direction. The reopening of EMTC, which CHS successfully experienced last year during the height of the first wave of the pandemic, was something that we recommended for several months, and we're really delighted that we could partner with the Department of Correction to open that up in September, and that allowed us to manage intake better, the system to manage intake better, but really importantly for purposes of this update, to sort of control the transmission of COVID in the system. That, together with the partnership with the state, between the mayor and the governor, has allowed the population density to go down in the jails. That both benefits, obviously, the people who remain in custody in the city system, and allows us really to implement more successfully in partnership with the department our COVID protocols. They remain the same in principle since 2020. Obviously, reducing the jail population, again, with the state, and CHS continues to make itself available to offer medical summaries to defense who wish to get that collateral information to make a case on behalf of their clients. The issues of containment, again, we continue to test and vaccinate, and really importantly to, with DOC, maintain or control patient movement and patient housing. The cohorting is critical. The changeover from OBCC to EMTC really gave everybody a little bit more room and space, literally, to better manage the housing and cohorting that we needed to do. And I think the numbers are beginning to reflect that. Access was the third. Access to basic services was the third pillar of our efforts since 2020. And CHS has, for several months now, been prioritizing services, critical services, to its highest risk patients, and really making those individuals the highest priority for production to us for care. We continue to work with the department to make sure that access is minimally disrupted as a result of externalities. But I will say that we continue to work on that, and the department understands the importance of that, and we appreciate that. I will say a little piece of good news isn't an immediate, but is very, very good news for correctional health services, which is, for several years, I think the board remembers that we briefed you on one of our initiatives, which was to create outposted therapeutic units in the jails. It basically is an extension of the successful in-jail therapeutic units that we established and have been growing within the constraints of the facilities that exist currently in the system. But we were able to really delightfully announce that their third site for outposted units in the Bronx, so that the plan is now to develop and establish these outposted units, not only at Bellevue, which is being accelerated to 2022. Next year, we expect that unit to be open, followed by Woodhull the following year, and our third new site, which is NCB, which is scheduled for 2024. We're delighted that brings us almost 400 outposted therapeutic beds for some of our patients who really needed and benefited from, at some points in time, life-saving care that's only available in hospitals, but for whom the logistics of arduous transport from jail to hospital was often a reason for declination of care. So I think I'll stop there.
We can have questions from the board now, or hear from Commissioner Schiraldi first. Do board members have questions Dr. Cohen?
I have two questions. One, could you comment on your current policy regarding overcrowding? Over half of the current, according to our last report, our last 7-day COVID report, over half of the population was in dormitories with greater than 75% capacity. All recommendations say that that's a dangerous situation and is much more likely to transmit COVID. The previous commissioner said that she believed that that was the right thing to do because CHS told her it was the right thing to do. I'd like you to comment on whether you still think that's the right thing to do. And my second question has to do with transmission of COVID within the jails. As I understand it, you have a policy of quarantining people and testing them to make, before they are admitted into the general population, to make sure that they don't have COVID. So basically, the transmission of COVID into the jails comes from correction officers because they do not go this process. There's no mandatory testing and there's no mandatory vaccination. Do you have an assessment based upon your epidemiology group what the how many additional cases of COVID will be caught on Rikers Island by people living there and people working there because of the mayor's decision to delay a mandatory vaccination till December?
Thanks, Bobby. We'll go back to the density question. The 50% or 70, you know, the idea there, I'm not, that wasn't a specific rule that we came out or a recommendation that we came out with. Certainly in congregate settings, it is widely understood and totally reasonable that the less dense the living conditions, the better. Physical distancing is not possible when you're living on top of one another. There was never a specific percentage or a magical threshold or number. What was more important then, and is still more important now, which was a tenet of one of our containment, was to identify people who are on similar points of the COVID spectrum, and to house them together and keep them together. That really was the key then, and remains it now. Certainly, congregate settings are not great for any communicable disease, much less airborne, but that is not reality. In terms of exposure and additional cases, I have no crystal ball for where this is headed anywhere else in the city. The numbers seem to be going down, but we're heading into the holidays, we're getting into the colder weather. Certainly, everything is a function of vaccination and testing and natural immunity. As this pandemic probably grows into an endemic situation, you know, that will begin to, I think, be reflected in the epidemiology and in the community, as well as in settings such as ours. Certainly, the vaccination rates among our staff has gone up significantly since the mandate went into effect for healthcare workers. I'll leave the DOC vaccination discussion to the commissioner. But what we have seen as a combination, I think, of more people having had COVID, people getting vaccinated, both staff and patients, you know, within the system and coming in from the community, and the testing and our ability to more successfully cohort has led to a decline in our positivity rates. And as incidence has gone down and new transmission, new cases in the system has gone down, I think that's a reflection of that, and hopefully will continue. The numbers have decreased significantly in the last few days, but you know, we're not celebrating yet. That is a function of so many factors that lead into statistics, but we're hopeful that the general direction is a positive one.
Thank you very much.
Just a couple points about what you said, Member Cohen. There's a bunch of ways people can get infected. People who come in who are incarcerated can bring it with them. Staff Correctional officers can bring it with them. People on tours can bring it with them. People who are vaccinated can bring it with them, although that's much less likely to happen than people who are unvaccinated. People who run and work in programs. So I just don't want to say it's only correctional officers. Our COs have a low vaccination rate, 57%. Our uniformed officers, non-uniformed officers, non-uniformed staff who were just required to get vaccinated now have a 92% rate. So that's, I think, about the number for all citywide workers with the mandate. My hope is that on December 1st, when our correctional officers have the mandate, that their numbers will be high like the rest of the city is. But that was a struggle for all uniformed staff in the city. I think my hope is that we do a little better than that, because now our staff will have seen what other uniformed members went through. But our hope is that it will go up again. There has been a pretty serious decline in the number of people who are incarcerated who have gotten, the positivity rate has gone down. I think it was actually 0 yesterday. Though, as Dr. Yang said, we don't want to pop any champagne corks over that, because every day it could change based on who walks in the front door. But we're working together between us and CHS to really drive those numbers down, and of late, they have been going down. So knock on wood, we hope it keeps going down, and we're going to keep pushing. We're doing a whole bunch of stuff to encourage our staff. We've got vaccination sites on island. We've got shuttle buses running from the facilities to go get vaccinated. People still get the $100. People still get 3 hours of comp time when they get vaccinated. They're running all sorts of ads. Just one last thing. You indicated there was no mandate. I just want to remind everybody, there is a mandate for uniformed officers to either test or get vaccinated. And again, on December 1st, it'll only be to get vaccinated.
I'm sorry about that mistake. I appreciate all that you're doing. I hope I share your hopes.
Are there other board members who'd like to speak?
Yeah, hi, Patsy. Jackie and I were actually here like a week and a half ago, and congratulations. I was really, really happy and encouraged that I saw that you have an adolescent, young adult board certified psychiatrist with Dr. Tedeschi. I just hope, that last tour that we were here, I was impressed by your team on the mental health side. I was really impressed by the DOE social workers and psychologists too, and Commissioner. I hope you tap into them, because you have unique resources that could be helpful to do what you want to achieve here.
Thank you. Are there other board members who'd like to speak in response? Okay. Well, I thank DOC and CHS for their updates and for their continued efforts to ensure the fullest protection possible of both staff and detained persons. Much more to be done, but appreciate all that you're doing. We have public comment now. I've been given a list of speakers who signed up to speak, and as we do in each of these virtual meetings, I'm going to call each person's name one at a time. And when you hear your name, I ask that you raise your hand using the hand icon below the participants list on your WebEx screen. If you don't see the participants list, click on the silhouette of a person on the menu at the bottom of your screen. Once you open the participants list, you should see the hand icon in order to raise your hand. When you raise your hand, we will unmute you, and you will be able to turn on your video. You can then begin your public comment. I'll tell you when it has been 3 minutes, and we will then move on to the next speaker. The board welcomes written comments as well, and you can email written comments to boc@boc.nyc.gov or mail them to 2 Lafayette Street, 12th floor, room 1221, New York, New York, 10007. I will now call on our first speaker. The list has been updated, so just give me a moment. Our first speaker is Madeline Feliciano. Good day.
Can you hear us?
Yes, we can. Thank you.
This is Madeline Feliciano, and I'm David Rankin, her attorney. Go ahead.
Hi, good morning. My name is Madeline Feliciano, and I'm the grandmother of Nicholas Feliciano. Nicholas was currently at Rikers Island in November of 2019 in the custody of DOC. And unfortunately, Nicholas attempted a suicide, and there was officers there with him at the time that Nicholas attempted his suicide attempt, and they just stood there and didn't do nothing to help Nicholas. I first want to thank also the BOC, the Board of Corrections, for their report. We were waiting. It's going to be almost 2 years now this month on the 27th of Nicholas' incident. So I want to thank them very much for their report. I'm very heartbroken. I'm very upset. I'm angry that this happened to Nicholas. And just knowing that these officers, I have their names here, Mark Perlarta, Captain Terry Henry, New York City Correctional Officers Daniel Fullerton, CO Kenneth Hood, CO Constantinos Macridis. I'm not sure if I pronounced that right. My apologies. Mark Wilson and Nicholas Prensa. These officers were at my grandson's side, and they just stood there and left my grandson hanging for 7 minutes and 51 seconds and didn't react, didn't even attempt to bring him down. One of these officers also went inside the cell for 14 seconds and seen my grandson hanging and just left him there. How could you do that? How could how could you explain this to me? And still today, 2 years later, these officers are still working in Rikers Island. How does that happen? And nobody has been accountable for their action. And my grandson, he survived, and he's at Bellevue Rehabilitation Center with anoxic brain damage. I don't know if Nicholas is ever gonna be the same. So who could explain to me how is it that somebody commits a crime on a suicide attempt and they still able to go back to work? And I need some answers. I've been saying it from the beginning. We need answers, and justice needs to be served, because this is not right the way they treat people. They discriminate them because of their background, or they're just not doing their job. They're not professionally trained to deal with mental health, to deal with suicide prevention. Nicholas didn't belong there in the first place. He was 18 years old. It was on his records that Nicholas needed help, that he had suicide attempts, that he needed to be on medication. He didn't have a one-to-one. They neglected him. They just tortured Nicholas. So I'm here today trying to seek justice for my grandson and for everybody else that their lives have been lost in Rikers Island. But overall, my grandson is still suffering, and these officers are still working. So who could tell me, who could give me an answer? What's going to happen? What's going to happen with these officers? Are they going to continue to go to work and get a paycheck, and it's okay what they did? No, it's not okay. It's not okay what these officers did. And I feel that the whole system should be changed. Something needs to be done. Something needs to be fixed. I'm just so, my whole life has turned around, my family, and somebody needs to be held accountable for what has happened. And a report was done. And all red flags is on the Department of Corrections. I mean, I'm furious. Just imagine, a loved one, a family member of yours hanging in a cell, and you got officers just standing there watching him hang. How do you do that? And then what you do, you suspend them for 30 days, and then they back at work. And my grandson is still in a hospital bed fighting for his life. Who could explain that to me?
Ms. Feliciano, we, we thank you for being here. We're going to follow up with the city, with City Hall, with the mayor's office, and with the Department of Correction. I believe that these officers, some of them were given a suspension initially, but I understand where you are, and we want to know what's happening.
I understand that this is in the district attorney's of the Bronx's office, and
Yes.
she is continuing an investigation that's been going on for 2 years. This is a cover-up, and it's terrible.
And what happens at the district attorney's office does not have to, is not necessarily indicative of what can and should be done at the city level by the city of New York. And so, as I shared, we're going to follow up and find out what is happening. I thank you for coming, and I'm sorry.
Thank you.
The next person to speak is Anissa Sabor. I see Anissa's name. I believe you are able to speak at this point.
Good morning.
Good morning.
I'm trying to find my camera because I would like to turn my camera on. So good morning again. My name is Anissa Sabor. I'm a directly impacted person. I'm an advocate and I'm an activist. And I'm here today because my heart is broken. Well, let me say this. First of all, you have these meetings and we appreciate the public comment. But I feel like we're talking to a brick wall. We come to these meetings and we tell you what's happening. We pour out our hearts for you guys to understand what the impact is really like and what's happening in our city jails. But you listen to the Department of Corrections, you hear them, but you don't allow the dialogue to continue with us at the table. This is where I think there is the issue of mistrust, miscommunication, right? Because you hear the Department of Corrections, they have an answer for every question that the board gives them. But they have no answers for the advocates and the people with the lived experience because they cut off their camera the moment the board stops communicating with them. So I'm just going to say that I am appalled at all of the actions that they stated are happening today, which I believe are just torturous, especially asking the mayor over the board to implement this executive order to, as they say, slow down the process of RMAS. I'm appalled that RMAS is going to exist at all. It's nothing but cages. It's still solitary. It's not really implementing what would help people address the behaviors. Stanley talked a good game. He ain't never been in solitary. and he believed that it's okay to continue putting people in cages? It's appalling. I really feel sorry for the families who have to engage in this. People are losing their loved ones. I don't really understand how much the board can really do, because for the year that I've been coming to these meetings, I've seen no change. All of the requests for variance, because they couldn't get one variance approved, they go over your guy's head and go to the mayor, who has done nothing in 8 years but waste my taxpaying dollars. And I am appalled that my money that I work hard for every day goes into a system that is continuously torturing and murdering. And I'm saying murdering because they're killing people. You can't tell me that everybody died by suicide. Everybody didn't. I am appalled at these people. I don't even know how they say that you guys are overseeing and nothing that you require them to do, they are doing. They got an answer for everything that is not right. And I am a person who lived through it. So for the family members who are going through it now, my heart is with you. I will continue to fight the mayor for his last 7 weeks in office and the Department of Corrections until they make some real meaningful change. And although you guys agreed for RMAS to be implemented, I'm going to fight to stop it. It is no need to continue putting people in cages for days, weeks, and decades. It must stop. It must stop now. I'm serious with this city. I am a taxpayer and I am a citizen. And I want to be treated like one. My money should not be going to caging people.
Yes, thank you. I appreciate your testimony. Thank you very much. The next person who is scheduled to speak is Sarita Daftery. You may begin. We've unmuted you and you may begin.
Thank you. Are you able to hear me?
I am able to hear you. We are able to hear you and now see you.
Thank you. My name is Sarita Daftery. I'm a co-director with Freedom Agenda and a member of the Jails Action Coalition. Today, I mostly want to convey a concern reported to me about a fire in NYC this weekend. One of our members is a mother whose son has been on Rikers nearly 4.5 years since he was 18. He has been in solitary confinement in NYC since September. It doesn't matter what the department is calling it, he and his mother know what it is. It's isolation with punishment, not rehabilitation, as the only goal, which functions as solitary confinement. This weekend, there was a fire in his housing unit. I was told that the officers did nothing to remove him and the people in his unit until the fire department arrived. He reported hearing an officer say, "Let them die." He is now being held in another area of NYC and has not received any medical attention after his exposure to smoke during that fire. He has asthma and has been coughing since the fire. His mother has contacted 311, though she has ceased to find filing complaints with this board useful. She noted that her son and people on his unit have been denied food, clean clothes, and linens before and after the fire. Knowing that this fire happened in a restrictive housing area, it should be further proof that isolation and punishment are not the answer to violence or disruptive behavior in the jails. Desperate people will do desperate things. Benny Basio may believe that you can deprive someone of their basic rights and punish them into submission, but that is not based in any evidence or reality. It will only make things worse for incarcerated people and staff. When the staff and policies create an environment of violence, as the Federal Monitor has noted multiple times, violence will continue. Related to that, I want to note that there was a conversation today about sexual assault against staff. The board must ensure that that conversation is expanded to a conversation about truly ending all sexual assault in the jails, including for people who are the most vulnerable, incarcerated people. There was the last hearing on this was in 2019, I believe. Hundreds of reported sexual assaults were noted. Incredibly, neither did the department or the district attorney seem to be rigorously investigating any of them. The sexual assaults that incarcerated people do report is only a trickle of what's actually happening. Our members and loved ones who are incarcerated Our members who have loved ones incarcerated and members who have been repeatedly say that they do not report violations of their rights in jails because of the fear of retaliation and the total control that officers hold over them. I feel it's important to note that in a meeting in 2020, DOC confirmed that incarcerated people were being subjected to strip searches before and after video visits. When people are routinely violated in ways like that, through the department's own actions, we cannot expect to rid the jails of sexual assault. Finally, in October, it was reported that Correction Officer Richard Wilson was charged with sexually assaulting a female officer. He was released on his own recognizance after being charged by the Bronx DA, who did not request bail, so we can only assume that he is back at work on Rikers. I want to again encourage the board to make that conversation inclusive of all concerns about sexual assaults in the jails. Thank you for what can be done in making public statements. And I want to say finally that since this is the last meeting and a meeting during a time of incredible crisis and violation of human rights daily in the jails, the board has to do everything you can. You need to say what's happening in the jails because you have access that other people don't, and it's a responsibility that you have, releasing all the information you have, doing the death reports and releasing them. Literally, lives depend on that. And whether or not it has an immediate result, it is better than not doing it. And we implore the board to do everything in your power. Thank you.
Thank you very much. I do want to state that when the board does complete death reports, once they are complete, they move through the process that has been established, and ultimately there's a back and forth with the Department of Correction and with the Correctional Health Services. Does not mean that we are changing the report, but we do have this process where we look at and ensure the accuracy of the information and of the investigation, and then the report is released. And sometimes we've done it in one-offs and sometimes we've done collective reports. I'm going to move to Kayla Simpson. I see Kayla's name.
Can you hear me?
Yes, thank you.
Wonderful. Good morning. I'm Kayla Simpson. I'm staff attorney at the Legal Aid Society's Prisoners' Rights Project. Good wishes to Chair Jones-Austin and Executive Director Egan on their next chapters. And we want to focus our time today on the emergency executive orders. Let's be clear at the outset, these orders are not just about the inexcusable delay in implementing RMAS, which, as an aside, as the members noted, if the department really sought just to have more time to create a new system, it could have asked the board for it. Every point made by the commissioner today could have been made to this board in the form of a variance request. And instead, this executive action actually goes much further than RMAS. It suspends very fundamental standards of correctional practice, including obligations that stretch back decades. And to focus on the first of them, removing limits on involuntary lock-in. I want to clarify something after hearing several exchanges today. Suspending minimum standard 105B is not about the disciplinary process at all. It's about out of cell time, about administrative lock-in, and it touches every single person in the jails. The ability to be involuntarily locked in a cell for no reason, absent a process, with no limitations on for what, for how long, and what services or healthcare must be provided in the interim. And this action, taking the guardrails off of lock-in practices, comes at a time when there is a documented high incidence of suicide and self-harm in the jails, which this board acknowledged. And the presentation we heard today about how DOC will address that issue inspires no confidence that they will take adequate steps to protect people, even in the status quo, much less with a blank check for cell confinement. And the orders lower the floor on a host of other fundamental items too, at a time that the city says it wants to move cases to resolution, no required law library access to help our clients engage in their cases, notarize documents, view discovery. The orders permit shackling people to furniture during limited out of cell time. And now we have a vacuum in the city standards governing the disciplinary system, due process, and constraints on punitive seg and ESH. The rulemaking eliminated the old floor of protections, and the order wipes out the new ones. People in custody are left in the dark as to what protections they now have and how those protections might change in a department that has a history of abusing discretion. Because that is one function that minimum standards are supposed to provide: predictability about how people in custody will be treated, and a watermark to point to when they aren't. The executive orders completely undermine that function. This is the last meeting of the year. Will the board really leave people in custody, the public, with no information about what is happening until January? Will people in the jails spend the holidays wondering if they can be locked in their cells at any time for no reason and for unknown duration? That's intolerable. The board can do more. The board's chief power is a conduit of reliable information, as Sarita was just saying, a view behind the walls. Board staff must be in the facilities, all of them regularly, and must report out what they see, issue findings, release photos, release data, and we can and are willing to offer myriad suggestions on what data points would be helpful. And as long as these executive orders continue, call special meetings, demand specifics from the agencies on what they're doing. Don't wait for January. The executive action, the mayor says, this is a crisis, so let's treat it like one. And finally, please issue notices of violation for standards outside of these orders that are being routinely violated, as was acknowledged in this meeting.
Thank
If
you
nothing
very
else,
much. You're at
it's a
4
signal
minutes,
to
so
other
I'm gonna have
decision
to.
makers in the city that those problems persist.
Okay, thank you very much. Let us now hear from the next person scheduled to speak, and that person being Josh. Looking at the last name. That person, Josh Goldstein. And as Josh Goldstein prepares to present, I just want to share in the event that Ms. Feliciano is still on with us and with others who are interested. The most recent update is that 5 officers were placed on modified duty. 2 were suspended for just 30 days. As DOC has charged the individuals, the Department of Correction has charged the individuals. The Bronx DA is determining whether it will move forward and indict them. DOC cannot further suspend the officers until they learn that that district attorney is moving forward. Then they can suspend for the duration of the criminal case. If the Bronx district attorney determines not to move forward, DOC that can then on its own move forward with its charges and would be seeking termination for all those involved. Josh Goldstein. Is Josh Goldstein still with us? I'm not seeing.
We have a Joshua on the line requesting to unmute.
Okay.
Mr. Goldstein, are you there?
Joshua Goldstein?
I believe he may be joining in under Andrew back. Yeah, Vaccaro. I'm gonna see his hand is raised.
Okay.
I believe Josh, Addison, and Andrew are all preparing to give one single testimony. So I think, Otto, if we can bring them up together, they can hand off.
Sure.
Thank you.
Good morning. My name is Andrew Vaccaro.
I'm sorry, before we begin, Andrew, is Josh signed in under Joshua? Is he on?
I'm not sure.
Okay.
Okay, and Addison?
Oh, there he is.
I'm here as well.
Okay, please begin.
Thank you. We're going to be sharing with you this morning some testimony from an incarcerated New Yorker. I was born, grew up, and attended high school in Brooklyn. My favorite subjects were global history and math. I completed 9th and 10th grade, and I earned my GED 2 years later. I also attended New York City College of Technology for a few semesters. After that, I traveled around, often coming back to New York City. A few years ago, I was arrested and sent to Rikers Island. I've been on Rikers Island awaiting trial for almost 5 years now. During my first year in Rikers, I did over 70 days in solitary confinement. Later that year, I got into an altercation with the staff. I was rearrested, taken to be arraigned, and then sent directly to solitary on the same day. On the way there, I was beaten by a special team called the Emergency Services Unit. My face was swollen from this altercation, but they mostly hit me in the body. They know not to leave too many visible marks when they hit you. A few days later, I was told to pack up my things. I was unable to do so because I did not have any of my personal belongings. I never saw any of my belongings again, including my legal documents from the building I was housed in before being taken to the box. I asked the corrections officers where I was being taken, but they wouldn't tell me. I was placed in the back of a van and then drove for hours. I fell asleep and woke up in a county upstate. I remember being confused why I was being taken hundreds of miles away from New York City, but they had sent me to a jail upstate without telling me where I was going. Upon arriving, I was beaten again by corrections officers in retaliation. The only reason I know that this was retaliation is because I heard them saying things like, "Oh, so you like to put your hands on guards." I suffered a concussion and a hole in my eardrum. My eye was swollen completely shut. I remember being in and out of consciousness, and I was afraid I was going to die there without my family even knowing where I was. I spent almost 6 months in solitary confinement upstate. It was different than solitary in Rikers. We were only allowed 3 showers, 2 30-minute calls, and 2 visits per week. On the day I was returned to Rikers, I was taken to the Enhanced Restraint Housing Unit and stayed there for 2 years. While I was there, I had to ask for everything from corrections officers. I had asked for water to drink, hot water to cook, a spoon to eat, and to be taken to the shower. They eventually give you the things you need, but they make sure to take their time. And everywhere I went, I was in cuffs and had my ankles shackled, even in the shower. In total, I did over 250 days in solitary. There's nothing to do in there but read books or the Bible, exercise, and sleep. Solitary gives you time to figure yourself out, but you can lose yourself in there. My daily schedule got me through it. I wrote letters and started writing a book. I played box chess by making 64 squares on the floor, making 2 sets of pieces, calling out moves to other guys in other cells. From here, I'm going to let Josh continue.
After being in the box for so long.
Josh is not with us, so is Addison.
He's here as Addison.
Please begin.
After being in the box for so long, you get used to being alone, and you don't want to be around a lot of people. It makes you nervous. Sometimes I find myself getting annoyed by little things people say. Since being back in the general population, it has been hard to readjust to being around people, but it also feels good to do everything myself. Even the little things like giving someone a handshake. I also get to play basketball with others and walk around. Still, I mostly keep to myself even after being back in the general population for 8 months. I've been through so much during my time here. For someone who doesn't know what solitary confinement does to a human being, it mentally and physically messes with you. No one can sit in a room for 23 hours a day for days on end. It's just not healthy for any human being. I hope solitary confinement stops and that jails will give us more programs to stay busy while we do our time. Things have recently gotten so much worse here. They're running out of the food in the commissary. There are no utensils to eat with and no cleaning supplies. We will go 2 or 3 weeks with no CO, and you can't get medical attention if you need it. You could be dying, and you still can't get anyone to help. We only get rec every 4 days now, and there's no one to help us in the law library. I still do not have a trial date and was only recently able to make a bail motion for the first time since being sent to prison. And that's the end of the testimony. Thank you.
Very much.
Thank you. The next person to testify is Ann Goodman. His name doesn't appear in the list of attendees. Ann Goodman. The next person is Natalie Fiorenzo. Natalie Fiorenzo. Natalie, if you're with us, you've been unmuted and you can begin.
Hi, everyone. Good afternoon. My name is Natalie Fiorenzo, and I'm a corrections specialist at New York County Defender Services. My job here at NYCDS is to work with our incarcerated clients on a daily basis when it comes to issues of their safety and their well-being. Over the last several months, I have seen up close the deteriorating conditions on Rikers Island. And my question is, where is the board during all of this? The board continues to fall short of our cries for change at Rikers. Fall short in your case is not a missed deadline or an unproductive morning. Fall short is 14 dead on Rikers in the past 10 months. The fact of the matter is that the Department of Corrections cannot provide basic standards of living for the 5,447 people in its care and custody right now. Commissioner Schiraldi claims that significant improvements have been made to staffing and conditions on Rikers Island, but we see no proof. The department's lack of bold action looks like our clients having broken bones, asthma attacks, open stab wounds with no one to bring them to the clinic. Last week, there was a fire in one of our clients' housing areas. He was locked in his cell by the corrections officers, writhing on the floor for over 30 minutes, barely able to breathe from smoke inhalation. The mayor's emergency executive order number 279, which was signed furtively just in time for RMAS's supposed implementation on November 1st, intentionally ignores the work advocates have been pushing for tirelessly. The fact that this training won't even begin for 22 days after RMAS was supposed to be rolled out reflects the lack of urgency felt by the Department of Correction for this change. The order allows DOC to shackle anyone indefinitely without reason, force anyone into solitary confinement without a hearing or counsel, and enforce no out-of-cell time. What kind of abhorrent response is this to the human rights violations we have been seeing and that have been occurring for months? You put decarceration on the hearing agenda, but how are you specifically advocating for release? Our clients are missing court dates left and right, dozens just this month. Court dates where these clients would be released from DOC custody. Our team has to call the client's facility, custody management, the court staff, the attorneys, back and forth for hours for a client to maybe be produced to court. If the goal is to decarcerate, why are our clients languishing adjournment after adjournment to be produced to court for release? One of the reasons we're given when our clients aren't produced is that they're in a quarantine unit. As of October 25th, 36 housing units on Rikers Island were under quarantine, 36 at one time. The protocol for quarantining procedures is immensely unclear. While we have one client that was diagnosed with COVID and placed back in his cell only 48 hours after his diagnosis, another client of ours has been under quarantine for over a month without ever receiving a COVID test at all. These discrepancies demonstrate the department's failure to abide by their own COVID protocols. They can only be held accountable by stakeholders such as yourself. So our asks today are as follows. Number one, provide us a list of daily staffing numbers per facility. Number two, provide us with the DOC's quarantine protocols in writing. Number three, schedule a public meeting with DOC every time the executive order is asked to be renewed. Ask them what steps they've taken since the last extension and why they need another one. In this board's final hearing of the year, we are telling you to take bold action immediately. You are the overseeing board. Please open your eyes. These are people's lives. Do not forget that. Thank you for your time.
Thank you. The next person to speak is Kelly Grace Price. See that Kelly Grace Price is here, but is muted. Is Kelly Grace Price to unmute herself, or do you take care of that?
We sent a request for her to
Okay.
mute.
Okay, perhaps she stepped away. We'll come back to her. The next person on the list is Megan Peterson, who does not appear to be here. Okay, I don't see Megan Peterson. The next person is Barrett Ellman, who also does not appear to be here. The next person?
I'm here. I'm here.
Oh, I'm sorry.
It's okay. No, no, it's fine. It's a, I'm just trying to get my system working. Start video, right? Okay. Hi, my name is Rabbi Bara Elman. I live in Brooklyn. I'm an activist who has worked with a number of organizations around criminal justice reform, including the Halt Solitary Act, the Freedom Agenda, the campaigns for rolling back, for ending cash bail, for less is more, for a variety of issues, all of which comes to the fact that my deep concern is for the rights and the care for people, our brothers and sisters who are incarcerated, especially in New York City, those on Rikers. There's a line very early in the Torah, in the second chapter of Genesis, Lo tov chayot ha'adam levado. It is not good for the person to be alone. This is why God creates a second person to accompany Adam in the Garden of Eden, and it's a profound existential statement about humanity, that we cannot be isolated. We are social. Isolation is, in the criminal justice system, is a euphemism for what is really a punitive act that denies and defies our essential humanity, our need to have company, to be with people. I've also had experience teaching people who are incarcerated, and I've heard from them their own experiences of what it is like to be in solitary confinement. One person wrote, "I was confined in the box on Rikers Island, and it was chaotic. I didn't have anyone to talk to but my neighbors in the cells next to me through the vent over my sink and toilet." Another one wrote, "When you get into confinement, they continue to degrade you and mess with your mentality, turning off lights with no reason, denying showers. You can't even eat because you can't trust what they did with the food. 9 times out of 10, you're in the box, solitary confinement, just because an officer doesn't like you." We've heard from other people testifying today about on the greater details of the processes by which this executive order was put into effect, and the request by the Corrections Department to ask for this amendment to return the policy of solitary confinement. And I speak speaking as a rabbi, speaking as a moral voice. I want to beg the mayor to rescind this order. I want to beg the board to ask the mayor and to demand that the mayor rescind this order. I don't need to reiterate all the other things that have been said by people here, but I share and endorse the passion and the sorrow, the grief and the anger that have been expressed by other people speaking today. I wrote testimony on I gave testimony on December 2nd, 2019 to this board on solitary confinement. At that time, the hope was that this was going to be ended. And in fact, we thought it was going to be ended. I cannot believe, and I'm now here, almost 2 years later, saying some of the same lines that I said at that time. It is way past time to end solitary confinement, and it is obscene that it has actually been reinstated by this mayor 7 weeks before he leaves office. Thank you.
Thank you. The next person to speak is Melissa Vergara, or Vergara. Forgive me for the mispronunciation of your last name. Okay. Good morning. Good afternoon.
This is Melissa Vergara. I am the mother of a son who is currently incarcerated in Rikers Island. My son has been diagnosed with a mental illness, disruptive mood dysregulation disorder, and my son also has autism spectrum disorder. Since my son has been at Rikers, he's been there since May of this year. He has experienced what is essentially traumatic for a person with both a mental illness and a developmental disorder. When my son first arrived at Rikers Island, he was having a mental health episode, and he called me, and I tried to be proactive and reach out to the facility that he was in. When I called and explained my son's symptoms, the captain I spoke to responded to what everything I was saying, said, "So you're calling basically because your son is angry and has an attitude." And that's not what his symptoms are at all. That's actually minimizing what his symptoms are. And then in June, my son was locked in his cell for 4 days with no mattress. And I got a call from another person incarcerated to let me know that my son did not have a mattress and was moved to another cell And none of his belongings were sent with him. All the things I've sent to him, commissary that I purchased for him, none of that was there. On August 15th, while the Department of Correction, while this correctional officers were protesting outside of Rikers Island in regards to their work conditions, the house that my son was in, they were all locked in their cells for the entire day with no access to food or water. They had no food that day and they had no water for the whole day. And again, my son has autism spectrum disorder and a mental illness, which is not, it's really detrimental to his mental illness. On October 23rd, 27th, my son was moved to another housing area, and he told the captain, and I do have the captain's name, but I'm not going to disclose that right now because this is something I am seeking legal action for. But on the 27th, my son was moved to another house, and he informed the captain that he could not go to that house because there was, I guess, issues within the facility with other people incarcerated. And the captain's response was, I don't give an F about what happens. Within an hour of my son being at that house, my son was stabbed and had to get seek medical attention. However, he did not get medical attention for 3 hours. On the 31st of October, a cell door was closed on my son's hand, resulting in a part of his finger being severed. He had to go to Bellevue so they can try to reattach it. As of right now, that part is black, and we don't know if it's going to stay that way. Again, my son's only 19 years old, and again, he has a mental illness and autism spectrum disorder. My son has also, they were giving him medication over a month ago. They stopped abruptly, and he has not been getting his mental health medication. He has had no access to the law library or to get access to a grievance officer to put in these grievances. There's only 60 days to put in a grievance, and with the staffing conditions, it also impacts the people incarcerated's ability to put in their grievances. But that's everything that my son has been going through there, being locked in his cell, not having access to a mattress, no food or water, no medication, and the physical trauma that he's going through, which is going to essentially impact his mental health and his mental health trauma. So that's what I wanted to state here today. I do hear about a lot of, the safety of the correctional officers, but we also have to start holding correctional officers accountable when they are mistreating people who are incarcerated, because they tend to treat them based on their charge and not them as humans. Not all of them, but there are quite a few that do.
Thank you.
Thank you.
Very much appreciated. The next person scheduled to speak is Harvey Epstein. I don't believe I see that person's name. Following Harvey Epstein, Melania Brown, whose name I do not see in the attendees list. Brandon Holmes, not here either. Shaki Antoine. I have a cousin named Shaki. Antoine is here.
Good afternoon.
Good afternoon. Thank you.
How are you? Good afternoon. My name is Asaki Antoine, and I'm the first citywide trustee of the Correctional Officers Benevolent Association. For the past year, I have expressed to you all the daily challenges correctional officers are facing each and every day in the facilities. I must state, triple tours are still an issue facility-wide. Triple tours are happening in EMTC. Triple tours are still happening in AMKC. And although the department are redeploying officers from borough facilities to alleviate triples, redeployment officers are now doing triples as well. Assaults on staff, including but not limited to broken orbital sockets and nasal bone fractures, have increased. Yesterday, a correctional officer was savagely beaten by an inmate, which resulted in a head injury requiring 12 stitches. Sadly, this officer did not arrive home the same way he came to work. Inmates are threatening and physically taking equipment such as keys, off of correction officers in order to open cell doors to commit crimes. Inmates are continuously housed incorrectly. The new classification system implemented by the current administration is not working. Inmates that are classified as high, more prone to commit violent acts, are placed and even hidden in low to medium housing, causing more senseless acts of violence. In the past 3 months, approximately 50 inmate-on-inmate slashings have been reported. Over 150 splashings of feces, urine, unknown substances thrown by inmates while correctional officers are simply doing their jobs. There has been 30 fires in housing areas set by inmates. Do you know that the inmates are using batteries purchased in commissaries to commit arson? Last month, I voiced my concerns regarding the inaction by the department and the lack of prosecution regarding sexual assaults on our female correctional officers. Since then, over the weekend, one more female correctional officer had her buttocks groped by 2 inmates while she was just doing her job. Since January 1st, 2021, 25 correction employees have been sexually assaulted by inmates. Of those 25 cases, 18 were correction officers, 17 were women, 1 captain, 1 male, and the other 6 were civilian employees. There has been a notable increase of incidents facility-wide. Do you know what has decreased? Accountability for inmates that commit crimes while detained. Somehow, City Hall, the Department of Corrections, inmate advocates, and some of you, members of the BLC, have found a way to blame correction officers for your failures to decrease violence in the city jails and to keep everyone safe. Since the implementation of the medical exclusion list, the majority of inmates who commit violent acts against correction officers and other inmates are not held accountable. Because of the medical exclusion list, the inmates are removed and placed in another housing area and permitted to continue their reign of terror on correctional officers and other inmates. Have any of you really reviewed the conditions that preclude inmates from really going to restrictive housing? As long as these conditions, the medical exclusion lists, are in place, the swift accountability as you, the BOC, so proudly proclaim for inmates that commit crimes while detained will be a detriment to any progress in regaining the security and safety in the jails. The medical exclusion list is a clear hindrance to progress, and it must be eradicated or revised. Every month I come and ask for assistance, every month. And Ms. Austin, again, I understand your position. I understand the board's position. Everyone should be held accountable, but it seems like it's very one-sided when it comes to correction officers. We're being blamed for the state of the Department of Corrections right now, and it's not fair. It's not. We came to work in numbers during the height of COVID. We did what we were supposed to do. Are we perfect? No, but that should be acknowledged. That should be acknowledged. Thank you.
So I just want to jump in here and say that I want to acknowledge that. And I will tell you that I had a conversation with COBA President Benny Basio about this very issue just a few days ago. Just as we should not paint every detained person with the same brushstroke, we should not do that with respect to every correction officer. So yes, thank you. And I acknowledge the same. I agree.
Thank you. I appreciate it.
Thank you. The next person scheduled to speak is Jennifer Parrish. You may begin.
Thank you. My name is Jennifer Parrish. I'm the Director of Criminal Justice Advocacy at the Urban Justice Center Mental Health Project and a member of the Solitary Campaign and the Jails Action Coalition. I'm deeply troubled that the administration's response to the humanitarian crisis in the jails has been to make conditions even worse for incarcerated people. They are the ones who have borne the brunt of this crisis, and the remedial response by the city and state has been at their expense. Rather than a concerted effort to provide for the release of women, they are being moved to the state prison system, farther away from their families, attorneys, and community providers. Although these women are still waiting for their criminal charges to be addressed, they are being relegated to the conditions of the state prison system. Rather than releasing sentenced people pursuant to the 6A program, these people have been transferred to state prison as well. These individuals who were receiving mental health treatment will not receive the discharge planning services required by the Brad H. settlement agreement, which applies only to people released from the city jails. The Brad H. settlement provides for specific services that people with mental health concerns need, and so that they can have connections to treatment, Medicaid coverage, medication, benefits, housing, and other services that they need. This type of discharge planning is not available to people in the state prison system. So people with mental health needs are harmed by the response to this crisis. And now the administration has suspended the board standards to allow lockdown for any and all incarcerated individuals without due process, continued placement of young adults in ESH, and continued use of restraint desk. I don't understand how the commissioner continues to say that the executive order does not allow for broader lockdowns separate from implementation of RMAS. The order specifically suspends minimum standard section 105 sub B. This is the part of the standards that relate to lock-in, and the subdivision which is suspended says the following about involuntary lock-in. People shall not be required to remain confined in their cells except for the following purposes. At night, for count or sleep, not to exceed 8 hours in any 24-hour period. During the day, for count or required facility business that can only be carried out while people are locked in, not to exceed 2 hours in any 24-hour period. I don't understand how the commissioner and the administration can claim that this does not give them the authority to confine people in their cells for longer than the periods required by the standard. The department is no longer bound by the 8-hour limitation on lock-in at night or the 2-hour limit for lock-in for count. The executive order plainly allows the department to keep people locked in as long as they want without any limit, and they should be honest about that. If this was not the intention to allow greater lock-in, then the mayor should not have included this section in his emergency order. This order was also extended last Wednesday. So if this is not the intent, this section of the minimum standards could have easily been removed. If this were just about implementation of RMAS, then the department should have requested a variance from the standards at the October board meeting, or even this meeting, rather than the mayor suspending the standards. The board almost always grants these variances, but at least the public would have had a chance to comment before a board vote, and there would have been a public discussion about the need for the variance. If the commissioner wants to build trust in the department, then he should tell us why the provision regarding lock-in was included in the emergency order. He gave an explanation to this board earlier about the reason he requested an executive order related to RMAS, but he has not explained why section 105B was included in that order. The board's minimum standards are the line for discerning what is the minimal level of human decency that must be provided to people incarcerated in the city jails. If these standards cannot be met, then New York City should not be holding people in jail. The consequence of not being able to assure these minimum standards should not be to continue and expand the deprivation of inhumane treatment of incarcerated people, but to decarcerate. The city was able to do that at the beginning of the pandemic, and it is shameful that this crisis is not being addressed in the same way.
Thank you. The next person scheduled to speak, I believe we have Kelly Grace Price back, or it seemed we did, but now I don't see her name. We'll come back. Scott Palchowitz. Doesn't appear Scott Palchowitz is here.
Jennifer, it looks like Kelly Grace Price is up.
Kelly, okay, please, Kelly Grace Price, begin your testimony.
Hi, thank you so much for your patience. I was having technical difficulties. I'm Kelly Grace Price from the Close Rosies campaign. I have written testimony that, as always, I will turn into the board. And thank you so much, Board Director Margaret Egan, for making sure that my testimony last month was posted promptly and appended with the latest federal complaint against docs for sexual violence in Bedford. I'd like everyone to take a chance to go to the board website, download that document and read it, because it describes in very plain language how 2 women who had been raped over and over again on Rikers Island, sentenced, and then sent to Bedford with all of the records that outlined in detail their previous sexual assaults at Rikers, sent to Bedford, and nothing was done to prevent their further conscription by corrections officers into sexual servitude. Bedford is not a better place, and Commissioner Schiraldi, I resent very much you trying to paint the lead of decarceration as sending women into this sexual torture chamber. I very much appreciate everyone's discussion of sexual violence today, especially COBA. It's nice to hear you. Please do not indict the advocate community for not speaking up for corrections officers on this issue. We have for years. We've taken the bus to East Elmhurst. We have continuously represented that PREA needs to be implemented, which does in fact include correction officer protections just as much as detainee and incarcerate population protections. I want to thank the board, especially Jennifer Jones Austin on her last day, for holding Commissioner Schiraldi's feet to the fire and making him acknowledge very plainly that he had requested the executive order suspending the implementation of RMAS. What we have seen over and over by the mayor and by this new commissioner are people that abuse their power when they have it. I'm ashamed to see the mayor exercising these powers and completely running an endgame around the community and governmental policies and procedures that are representative of our democracy. Mayor, you campaigned for president on an anti-Trump platform, but your own actions are so Trumpian that I feel like you should maybe get yourself some golf pants and get out on the golf course. I don't want to really point the finger for this crisis at anyone no less than the mayor himself, because as I have maintained throughout my tenure standing before this board, the mayor has subverted the board's ability to perform its oversight duties at every step, predominantly by abusing the appointment process, but also by abusing these executive orders. And the only answer is to fight this legislatively with a charter rule change and legislative preventions to prevent the mayor from continuously issuing these executive orders. And all these things take work. And we'll get it done, but at the end of the day, for the mayor to leave the community in a lurch like this is shameful. And I very much hope that people respond to him by not donating a dime to his gubernatorial campaign. I have a lot more to say. I've taken up already too much time. I want to thank you, board chair Jennifer Jones Austin, once again for your stewardship and for your poise today. I heard loud and clear everything that you said, and I'm trying to model my own outrage on your restraint. I want to thank you, Bobby Cohen, and you, Philippe Franco, for asking very plain questions to the department about their plans and their lack of implementation and the deadlines. The rest of you board members, I really don't know why you're on the board, honestly. I don't see a lot coming from you other than just plain support for the mayor, and you really should be ashamed. I cannot wait for your tenure to be over. Again, I will submit my written testimony. It's technical and it's detailed, and it again calls for data, which we've heard absolutely no data from the department today on any of its plans. I'm ashamed, Stanley, to hear from you that your entire plan to move women to Bedford depends on the advocacy community, on your outreach, on the community programs that you work with, because those community programs are not so happy about the move. So please don't point back to the community and make us responsible for this move when you yourself know that most of the advocacy community around Rosie's is up in arms about this move. I'm tired of the sound of my voice. Again, thank you, Chair Austin, and thank you, Director Egan. I hope that you do respond to the demands that have been outlined today, and you do call for meetings with the department every time the executive order needs to be renewed. I hope you do schedule an emergency BOC meeting in December, and I wish you well.
Jennifer, I think you're muted.
For the record, I thanked Kelly Grace Price for her testimony, and then I called the name of Scott Palchowitz. Who I don't believe is here. The next person scheduled to speak is Francis Gitelis. Or Gitelis? Francis, whose name appears here, Francis Gitelis. Gitelis Shapiro. Are you still with us? Yes, you've been put into the panelist box and will soon be unmuted.
Okay.
Please begin. Please begin.
Okay. Hi. My name is Francis Catella Shapiro, and I'm a member of the Halt Solitary campaign. I also have been a member of Physicians for Human Rights since 1992, during which time I have seen countless, maybe a couple of hundred people who've been the survivors of torture, in that case in other parts of the world. But it makes me aware of the nature of the torture and the psychological impact that it has. Listening to what we've been talking about today, or what various people have spoken about, one of the things that's obvious is that torture is a crucial feature of the social context of the prisons and jails here in New York. We've heard talk, well, I've mentioned before solitary confinement, where we've also heard talk about rapes and of beatings. So you have an environment in which there is so much anger and so much rage that it is hard to separate out how you make that into a more livable, caring environment. And people are, when we hold rallies about what you're doing and about the way that the prisons are running, one of the things we hear all the time from people who have been incarcerated at Rikers or other city jails is the extent to which that they feel that they are being dehumanized, the extent to which they are being treated as less than human and totally degraded. So what you have coming out of that, of course, is anger and is possibly severe depression, which can lead to suicide. And so that may be at least part of what's accounting for the increased rate of suicide attempts that you've been experiencing recently. You have an environment which causes that. And so that environment needs to be changed. And there needs to be a serious understanding of the existing culture and a serious effort to change that culture. And so far, in all the time that I've been here testifying, I don't see that happening. I don't see the board taking the necessary measures to make sure that we have a more human environment for the people who are incarcerated there. And possibly also then it would be a more human environment for the corrections officers as well. One of the things I particularly wanted to address, in addition to the mayor's new rules, is that people keep talking about when are they going to implement RMAS, as if that's a panacea, and as if in reality that will put an end to solitary confinement. It's just not true. The way that it is set up with a cage in front of a cell, and the person is put into a cage and they consider that out of cell time, makes no sense at all. Because the key feature of solitary confinement is isolation. And if you're isolated in your cell or you're isolated in a little cage, it's irrelevant. The fact is you're still being isolated and you're still being forced to suffer so much human pain. We know that that's what the problem really is.
I'm going to have to ask you to wrap up. You've got about 20 more seconds. 20 more seconds.
Okay, you have to stop calling RMAS ending solitary confinement. You have to really end solitary confinement. And so far, you're not doing that. Thank you.
Thank you. Thank you. The next person scheduled to speak is Kelsey de Avila. You're here and you've been unmuted. You may begin.
Hi, everyone. My name is Kelsey de Avila with Brooklyn Defender Services. Just want to echo a lot that's already been said, but this board has access to records, access to the jails, access to people in ways the public does not. And yet when we're faced with another horrifying period in this city's jail history, you're silent or vague on what you know, and when you're confronted to act, you throw your hands up as if you can't do anything. And this board has a responsibility to be transparent. Share what you know with the public, not in the years to come, but right now. Share data, share photos, share when DOC refuses to answer your request for information, share when DOC and CHS violate your standards, hold hearings, have them answer for why they can't do the minimum. Don't take their non-answers, which we got a lot today, as answers. Don't shrug, not file notices of violation because, quote, it doesn't do much. We know DOC is in chaos. That's kind of their thing. But letting DOC violate standards will not improve conditions or safety for anyone. The public, judges, courts need to know exactly what's going on, and that's where you come in. You not speaking up, not sharing what you know, creates a perception that things are good, that we're out of this, and that's just not true. Our office comments at every meeting sharing stories of people who are hurting because of DOC's inability to protect. And despite what the commissioner said today, people right now are being locked in their cells for 24 hours a day without due process. So either he doesn't know or he's lying. Because multiple cases of DOC are claiming people, quote, want to be locked in their cells, while CHS is actively aware of them decompensating, actively aware of their suicide ideation. Stories of feces covered on the walls of the cells with no urgency. People isolated from their families and attorneys because housing units are without staff to bring people, or where staff stand off to the side while they watch planned assaults on people. And I can go on and on. Rikers is a crisis, and our mayor is doing everything in his power to not address it. He's punishing women by sending them all to a maximum security prison, miles away from their family and attorneys, which we know will result in delayed trials and longer incarcerations because people cannot adequately prepare for their cases. The answer is and will always be to decarcerate, not sending people further from their families, not undermining basic services and standards, not executive orders that will torture people with unlimited and unchecked use of solitary confinement, all because DOC staff refuse to work. The board should do everything they can, administrative, political, legal, public and private, in city hall, city council, courthouses throughout the city, to end this executive order and call out this administration's inability to keep people safe. With that, thank you, and to Meg Egan, Jennifer Jones-Austin, wish the best of luck on your next chapter. Thank you.
Thank you very much. The last person scheduled to testify is Julia Solomons. You are here and you've been you're unmuted now. Please begin.
Thank you. Good morning, everyone. My name is Julia Solomons, policy social worker at the Bronx Defenders and member of Jails Action Coalition. We thank Chair Jones Austin and Executive Director Egan for your service to this board, and I'm sure that yours are not easy roles to play. I struggle with where to begin in this space. It's all already been said dozens of times today, in past meetings, at rallies, in the media. Everyone present in this space is aware of how unacceptable the conditions in our city jails are. And yet, not only do people in custody continue to be subjected to these conditions, denied adequate food, medical care, basic necessities, but astoundingly, the only changes that seem to arise actually make things worse for people in custody while claiming to be a solution to this crisis. The department has proven over and over and over again that what they share in these meetings does not match the reality of what's happening in the jails, and that their promises to this board are often empty. The commissioner's assurances today that we can trust they will not subject people to 24 hours of isolation and that they're committed to ending solitary confinement are not comforting. One clear and recent example of these empty promises are the Bedford Hills transfers. Bronx Defenders has had multiple clients transferred to Bedford that we had specifically identified as those that should not be moved yet for one reason or another, and that we were told we would be notified if and when they were transferred. We received no such notifications despite hours of conversation with DOC assuring us that we would. DOC also fails to share critical details in these updates. For one example, in a recent video conference attempt, BXT advocates found themselves staring at a toilet in the booth that the client was to be produced into. So when DOC says that they've created new booths for court production, they fail to share that people in custody are appearing for legal visits and court appearances alongside toilets and dirty laundry. We acknowledge that this damaging and destructive executive order suspends critical minimum standards and that the board is limited now and often in what they can do to stop the torture people are experiencing in our city jails. But the fact remains that the department cannot be trusted to act without true oversight and monitoring. The board has an urgent responsibility to people in custody and has failed to act repeatedly throughout this crisis. We appreciate the candidness from a few board members today. However, the larger and ongoing silence from this board is painful. At every public meeting, it is painful to watch the board members who choose not to speak out publicly, not to hold DOC publicly accountable for their failures to keep people safe in custody, to adhere to minimum standards, and to implement the restrictive housing rule in a timely manner. Of note, the public comment period should be at the beginning of every meeting so that members can ask DOC in the moment about what the public and advocates and impacted people have shared. Additionally, every public report that could expose critical data about the conditions in the jail that does not get published directly causes the continued incarceration of more people, the continued denial of the reality of the conditions by judges and prosecutors. Silence from this board, both literal and figurative, causes undeniable harm. So we urge you, as all the advocates have and do every single meeting, with increased desperation to reflect the desperation in the voices of our clients in custody, to please act. Please speak out publicly as a united board against this executive order. Keep a close personal eye on the use of punitive SEG and ESH as they shamefully continue to operate, and release any and all information you have on deaths in custody and ongoing horrifying conditions. More lives can and likely will be lost between now and the end of this year, and this board has a responsibility to prevent that from happening. Thank you.
Thank you.
Jennifer, I wanted to let you know that Harvey Epstein is back.
Okay, so we will hear from Harvey Epstein. You're unmuted and can begin speaking.
Yeah, just good afternoon. I just wanted to thank you for letting me speak. I, been listening to most of the hearing, and I realize, as someone who's been to Rikers Island, who's someone who passed the halt solitary confinement legislation, I'm really dismayed to see what's happening before you all. I have some really deep concerns about what's going on in Rikers, and I feel like the answers that even at the hearing we had, the assembly hearing a couple of weeks ago, and even today, is saying we're trying and we're doing better than we were before. But I think those answers continue to be unacceptable. I saw people locked in for 24 hours. I was talking to people behind the walls, and they were basically saying, I can't get out. I saw people going in from solitary unit to their solitary yard. This has nothing to do with this is not complying with the halt solitary bill that we passed in March of this year. And so I really hope that we see real reform coming out of docks. What we saw with people who've given up, they're people who are locked in Rikers, have nothing to do, literally nothing to do. There's no school. There, people are like, well, if you want school, you can just go on your tablet and you can watch a lesson. There's no school. There's nothing to do. There's no barbershop. There's nothing. Maybe things have gotten better in the last couple of weeks since I've been there, but the inhumanity that happens both for the inmates, the people who are there, and people who are working in corrections is beyond what's reasonable. And I don't think the urgency that we've talked about this crisis is being heard here. With 14 people who died on Rikers, people who died who shouldn't have died, I would expect more urgency and response. I'd expect more immediacy and action. I understand that you're understaffed, but then there's a lot to do. There's a lot more that I expect you all to do. So my message to you is a message that you've heard time and time again, is that, this is a crisis that cannot wait. This is a crisis that needs you to act. We can't expect more people to die. We can't expect people to feel humiliated and to feel like there's no future unless you make Rikers a better place. And we want to close Rikers, and I hope that we close Rikers tomorrow, but knowing that's not going to happen, you have a responsibility to all of us and the people who are in Rikers, both who are working there and who are being forcibly detained there, to do better for them, which means providing more services, providing more support, and not to have a solitary confinement unit that's not humane. And that's all I saw there. Seeing people sleeping on the floor, seeing people with severe mental health issues not getting services, seeing people who are in crisis not being responded, hearing from people that they feel victimized while they're there. These are all stories that I have personal experiences because when I was there just a few weeks ago. So I implore you to take all necessary steps to get programming back in on a regular basis, not just services, but all programming back in, to get people engaged, to make sure there are people with mental health needs, get the mental health services that they need, and to get people to a better location, because right now Rikers is abysmal. And I understand you are trying to do the best you can according to what you're saying. I just don't see it in your actions. So I hope that this board takes up the call today to protect the people who are on Rikers Island. I hope that you do much more. I will submit more in writing, but I appreciate you letting me speak for a moment on the crisis that exists today on Rikers Island.
Thank you. Thank you, sir. Very much appreciate your being here with us, Assemblyman. Very much appreciated. We have concluded the.
Jennifer, I'm sorry. Danielle Gerard signed up to speak. For some reason, she didn't make it onto the list, and she is here.
Who is this?
Danielle Gerard.
Okay. Has Danielle been promoted to a panelist? Thank you. Okay, please unmute Danielle. Okay, you are unmuted and can begin speaking.
Thank you very much, Chair Jones-Austin and Ms. Egan. We wish you the best in your next steps. I'm a senior staff attorney at Children's Rights. We've been a national advocate for youth and state systems for over 20 years. We are also a member of the New York City Jails Action Coalition and the constituted Young Adult Task Force. We appreciate the commissioner's reported strides in reducing violence on the island, reducing the number of guards, triple shifts, and increasing vaccination rates among the staff, but the crisis on Rikers has not abated. The mayor's recent executive order, which we just learned today the department itself requested, certainly hasn't helped matters by suspending the board's minimum standard 628 restraints, which will allow the continued shackling of young adults to desks. The executive order is a fitting testament to the saying, when in danger, when in doubt, run in circles, scream and shout. That is what this administration is doing. But it is the young adults on the island who are in danger. They are in danger because of the mayor's failed policies and his inattention. They are in danger because of officers' failure to show up to work while forcing their colleagues to work double and triple shifts. Young adults are in danger because our criminal system keeps sending them to New York City's version of Dante's Circles of Hell. Young adults are in danger because they are simply not getting the attention they need and deserve in the form of programming, education, mental health services, and even basic services. The board must act to ensure that the department provides essential safeguards to protect the rights of all incarcerated persons on Rikers, especially those of young adults. Advocates have been told that violence among young adults is 9 times higher than among adults. Again, this is because they are not getting the attention they need and deserve. The August letter from the Nunez monitor to the court concerning the current crisis on Rikers emphasized the systemic dysfunction in New York City's jails, no matter how much the department clamors for euphemistically named forms of punitive segregation, including RMAS. Conditions do not improve on Rikers for young adults or for those barely a few years older. Among the many people who have died in custody this year, one was 24 and one was 25 years old. We would like to emphasize that every incarcerated person, especially young adults, should always have 14 hours lockout time, whether separated from general population or not. Any less is inhumane and does not lessen the violence rampant on the island. Interaction with other human beings, including regular congregate programming, is essential to avoid adverse mental health effects for a population that already suffers high rates of mental illness. It is long past time for a complete, thorough, and effective overhaul of the carceral system in New York City. We implore you to start today. Thank you very much.
Thank you. Very much appreciated. Thank you very much. We have, that concludes the testimony portion of our meeting.
Yeah.
And we're now going to move into executive session if I get a motion and the motion passes to do so. So the board will now entertain a motion to go into executive session to discuss legal issues with the board's general counsel. If the motion passes, the board's executive session will not be open to the public. However, the board will return to public session upon conclusion of executive session. So just want to make sure people are clear on that. We will return to public session upon conclusion of the executive session. I ask for a board member to move to vote for a vote to take us into executive session.
So moved.
Second?
Thank you. And now I will call for a vote to go into executive session. All in favor, please say aye.
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 I don't think I heard from everyone, but are there any opposed? Unless you say differently, it seems that there's unanimous approval to go into executive session. Once executive session is complete, we will return to the public meeting. Okay. Adele, are we back in our public board meeting?
Yes, we are back in the public board meeting, but the YouTube stream isn't up at the moment. Give me 1 second. We do have a backup recording on WebEx that we can post. So if you'll have to post it separately on our site, we can do that.
Would you like us to hold while you figure it out, or are we?
Yes, if I could just get 1 minute.
Okay.